Okay, everyone, good morning. Thank you for coming to today's Strategy and Resources Scrutiny Board. I'd like to just start by welcoming Councillor Almas, who's joined the board. Welcome. Must have got special recommendation to come and join the board, so that's fantastic. And also Councillor Grewin's your first meeting of the year. Thank you. You had prior commitments for the last one, which is totally understandable. And I'd also like to welcome my son Jonah, who's here observing. That's the joys of summer holidays and dads who have meetings in the town. But there you go. He's okay. Okay. So moving on, let's just do some introductions if that's all right with everyone. So I'm Councillor Andrew Scopes, as it says on the screen. I chair this meeting and represent the Beeston Holbert ward of Leeds. So I'll pass over to my colleague this way.
Morning, Councillor Caroline Gruen. I represent Bramley and Stanningley, and as has just been said, it's my first meeting today.
Good morning, Councillor Gower Almas from Beeston and Holbert ward, and I'm glad to be back at the Strategy and Resource.
Good morning, everyone. Councillor Peter Carlill, Carlin and Farsley ward.
Good morning, Councillor Kevin Ritchie, Bramley and Stanningley ward.
Good morning, Councillor Sharon Burt, Middleton Park ward.
Hi, I'm Richard Ellis. I'm the Deputy Chief Officer, Financial Services.
Good morning, everybody. Councillor Deborah Cooper, Executive Board Member for Resources.
Good morning, Stephen Blackburn, Innovation Lead, Integrated Digital Service.
Good morning, everybody. Leonardo Tantari, Chief Digital Information Officer, so in charge of the IDS team. Thank you.
I'm Neil Evans, Director of Resources.
Councillor Sunforth for the Harewood ward.
Morning all, Billy Flynn, Councillor for the Adler Wharfdale ward.
Hello, Becky Atherton, Principal Scrutiny Advisor.
Okay, thank you very much, everyone. I'll pass over to Becky for the first few items. Thank you.
Item 1, appeals. There are no appeals against refusal of inspection documents. Item 2, there are no items excluded from the public domain. Item 3, there are no late items. Item 4, can I ask any members to disclose interests in accordance with Leeds City Council's Code of Conduct? I will take silence as none. We've got apologies, item 5 from Councillor Chapman. And then moving on to the minutes, item 6.
Oh, sorry, I also got apologies from Councillor France Meyer, who's unwell this morning. Thank you.
Moving on to the minutes, there's a number of issues to note. In relation to minute 7, the process is now underway to transfer the functions relating to civic enterprise Leeds from the Environment, Housing and Communities Board to the Strategy and Resources Board. Minute 9, we've received some additional information from finance officers this morning, and I'll circulate that to members of the board this week. Minute 10, the further information requested about the creative industries was circulated to members on the 14th of the 7th. Information about the apprenticeship levy and the workforce EDI plan was circulated on the 20th of the 7th in relation to minute 11, and further information relating to minute 12 was also circulated to members on the 22nd of the 7th.
Thank you, Becky. Are there, for members of the board, are there any issues on matters arising or matters of accuracy in the minutes that you want to raise? No. Okay, we'll take those as a fair and true reflection of last time's meeting and move on to item 7. So this is digital strategy, so I'm going to pass over to Leonardo. You can assume that we've read the papers, but if there's anything in particular you want to draw out, please feel free to.
Okay, thank you very much, Councillor Scope. So today we have a report on digital strategy, which will give you a highlight on what the digital strategy is and how it is emerging and how that fulfills the city ambitions. But it will also give you an overview of how that fits within our innovation programs. I'm joined today by Steve, which will guide you through a little bit of the main points, and then I will be available to answer any question that you might have. So over to you, Steve.
Thanks, Leonardo. Good morning, everybody, again. So just to give you a broad overview of the report. As Leonardo says, it gives an overview of the digital strategy that we've been working on. This has been a strategy that's written not necessarily from the perspective of Leeds City Council or CCG or any other organisation, but one that we want any organisation across Leeds to be able to look at it and see themselves in it and perhaps contribute and collaborate to the delivery of it. The report also discusses a bit more about the wider digital transformation that integrated digital service is leading on. And as Leonardo says, the innovation programme that is aligned to that digital strategy to ensure that our innovation activity is strategically aligned and that we focus our energies and efforts in the right areas. I just want to make a point really on page 16. I think it's important to note that, you know, the digital first but not digital only focus. This is not just about shifting from analog, from face-to-face telephone to digital. This is about providing additional ways to access our services. So that's you know, I think an important point to make. I think another important point to note on that first page as well is we also recognise, you know, the challenges in the wider digital sector at the moment in terms of staffing and resources. There's a couple of paragraphs there in terms of how the integrated digital service is dealing with that and how it affects the council and CCG. In terms of the top three priorities for us in IDS, system flow is about ensuring that the right data is captured in terms of looking after patients, and that data, that information about that patient follows that person around whichever part of the healthcare system, whichever part of the system that they're in. Core business transformation is another priority area, in particular looking at finance, procurement, HR and payroll. This is not just a piece of work, however, to look at existing systems. This is a whole system approach. This is looking at people and processes as well. We're working with EY, who bring in industry expertise, who can give us an outside view of how we transform those areas. And finally, another priority, of course, is looking at a security operations centre. It's important that we deal with increasing cyber threats and that we have a 24/7, 365 approach to identify those threats and dealing with those. Other priorities, the shared care record, so building on the Leeds care record. This is where clinicians across the healthcare sector, across the healthcare services rather, can view a patient's record regardless of where they sit, whether that be in healthcare, whether that be in the hospital or elsewhere in the system, and looking at how we work closely with the Yorkshire and Humber care record and take that more regional approach, and indeed how that links in with the digitisation of social care records. Another point there, of course, we're always looking to identify opportunities for funding to support this work going forward. In terms of the strategy itself, the strategy supports the pillars of health and well-being, digital, inclusive growth and carbon zero, and also the best city ambition. And it follows that best city ambition life course approach, so very much taking a person-centred approach. It's important, therefore, that digital supports people to start well in life, to live well, to work well and age well. And very much the approach taken is around the person. It's important, though, that the digital foundations are in place to enable us to do this digital transformation, so that we're collecting and utilising the right data, that we have the right connectivity and infrastructure in place. Of course, digital inclusion is a big area of work with our 100% Digital Leeds programme. That we all have the right skills, whether that be outside in our private lives or within our working environment as well, to enable us to deliver those services. And finally, digital and data ethics really does underpin all of this. It's important that just because technology allows us to do something that we don't just do it. It's important that we do it in the right way. And finally, that our innovation programme supports all of this and, like I say, takes a strategic approach. We want to promote Leeds as a city of innovation excellence. So we want to encourage businesses to come here. We want to encourage graduates to stay here. And it's important that we're innovative in our organisation in how we deliver our services going forward. And that will be, like I say, our innovation programme that will look at how we work with suppliers, how we deliver innovation labs and hack days, for example, can be strategically aligned with our strategy and our priority areas. So I'll pause there and open up for any questions. Thank you.
Thank you very much for that. Okay, members who want to ask questions, please indicate, and I'll bring you in as you come up. Okay, so Councillor Firth.
Thank you very much for that introduction. I just wanted to ask a bit more about the Security Operations Centre, particularly because of the fact that in the day and age that we're in, simple fact is protecting people's data is absolutely paramount. In terms of it, in the report, it indicates that the council obviously does not have the resource, neither does it have the capability to provide that. Could you just provide a bit more meat on the bone on how we will procure that service and provider, if you have that detail? Thank you.
Thank you very much for the question. So the Security Operations Centre will be a city initiative. So we'll have also F organization which will come to actually help us with the funding of that centre. It's something that we have been discussing over the last year with Leeds Community Health, LTHT, and YPFT, third sector, and also now what is the ICB, because the CCG have actually closed down. So it is a joined up initiatives where we will actually look at resourcing through the health organization, as well also from some funds from the authority, but is a joint organization which will look at creating a new operational team which effectively look after our security 24/7. Right, we'll have still to discuss the operational side, how it will work. For example, if we outsource it or if we do it partly with resources which are internally within the organization. So that is primarily how we are going to address that, and particularly from a fund perspective. We have presented these at PEG in the last couple of months, so we got to go ahead now to look into the costs and how that might work. So we need, of course, to have a little bit more time to detail the different costs and also to detail how we are going to absorb those. There is an interest also at regional level for the Security Operations Centre. So, and as part of my role, I'm also the ICB CDIO for Leeds. So I will ensure as well that I will tap onto some of the resources, of course, which will be available at the regional level as well. So hopefully that gave you a flavour, but we can come back, of course, when we have the full details and the costing.
Thank you. Is it a follow-up question, Councillor Firth? Okay.
Thank you very much, Chair. And I think it's certainly helpful that we have NHSX and NHS Digital in our city. That certainly will help towards that, hopefully, proving forward. But certainly setting a record and setting a milestone compared to elsewhere in the country. There is also the mention of further to the government's white paper on digitising healthcare and care records, which sets out that by March 2024, 80% of all registered providers' care records should be digitised. Could you give us any meat on the bone about the current situation in Leeds in relation to where we are in terms of actually achieving that target? Thank you.
Thank you very much for the question. So we are quite lucky in Leeds because we already done quite significant amount of work with the Leeds Care Record, which of course you might have heard of in collaboration with a number of organizations. And we already shared records through that system, for example, from adult social care with actually this system, which is in LTHT. And also we provide information which I shared also to Leeds Community Health. However, that program has been running for quite a while. So we are replacing it now with what Stephen mentioned earlier on, the share record programs, which would be an enhancement to actually the Leeds Care Record. Additionally, we want to take the opportunity to join that up to the Yorkshire and Amber Care Record, which is already live in a number of other organizations. So we're actually quite in a good place. However, what we need to do is enhance the type of data we share. There's unlimited data that is being shared through the Leeds Care Record, and that is part of the scope of the new Share Record program. We have been doing a lot of work through the last 12 months through the data office of analytics to ensure that we now, for example, can share care plans from adult social care, which will go part of that program. So actually, Leeds is in a very good place. I would say there are some more operational type of data, which is still not shared, and we will be looking at how we enhance that sharing between the different organizations. Of course, as you can imagine, we need to be safe, secure, as we enhance the data shared between the organization, for example, the care plans into the hospitals or the new transfer of care hub, which has been recently created. So we are in a good place, but there is certainly much more work that we need to do in order particularly to respond to that challenge of system flow, because the City of Leeds has quite some low statistics when it comes to discharge from LTHT. So that is what we are working on, which is part of that care record as well. Challenge is fits all together.
Thank you very much. Okay, I'm going to bring in Councillor Flynn.
Thanks very much indeed. I've got a couple of questions. One is a continuation of the one that Sam has just asked. I don't know if either of you have worked in the NHS over the years, but I think you'll probably both know they have rather a checkered history in terms of the introduction of IT going back 30 odd years when I was first involved in it. And the problem has always been the vast amount of data that you have to digitalize in order to make the system work. And as recently as just a couple of weeks ago, you can't even book your own appointment in hospital, no matter what they say, because appointments will not be given out by consultants because they want to keep their waiting lists low. So it doesn't matter how good the system is if the people who actually are using it aren't actually prepared to fully comply with it. So I just wanted to know what kind of issues you think they're going to be. I'll give you all three of the questions first, so they come back. And if those problems have been overcome. I mean, I think there are something like 120, possibly plus million GP appointments alone a year, let alone the information, the health information on individual patients. Secondly, the key risks, para 69 on page 23, you haven't actually outlined what they are in the paper. And I'd like to know what they are. I think Stephen mentioned very briefly about skills, and that's a point that interests me a huge amount. You know, how you're going to ensure that staff here are able to cope with the influx of technology that we're actually having. And three, rapid rollout. And I understand the reasons why, pandemic and all the rest of it. But first and foremost, you know, usually when you introduce any kind of a new system, you suck it and see. Basically, does it work? Are you sure it works? You know, are you sure that the staff know it works? So on and so forth. And in terms of key risks, I think you mentioned hacking, but I wondered about confidentiality, because the kind of information that you're storing here is personal to every single person in this city, and they don't want it released. And what I do know is you can absolutely guarantee if there's information in the cloud or whatever the hell it is, it will get out eventually. So I've no issue at all with innovation, and you've listed a number of the areas within the council where you are improving the systems and all the rest of it. I'd like to know a little bit more about what you're doing there too. Okay, I mean, I'll just give you an example. By the way, I think it's Richard on the end there. We had a briefing last week, and it was staccato to say the least. The interface between us, presumably because of a poor IT connection. If there had been five or six of us there, it would have been impossible to sort of go on. Unless the IT systems we have are perfect, or at least it's perfect most of the time, how do you actually, it links in with the next item on the agenda, which is agile working. How do you know, that it won't affect adversely the business that we're trying to carry out for the people of this city? Thank you.
Okay, thank you very much for the question. So on the first one is very much a challenge which we have as part of system flow. This is why the Transfer of Care Hub was created, to actually look at the operational side of things, not only technology. There is actually a program which has been initiated, of which Tim Riley, which is now the accountable officer for ICB for Leeds, is presiding, as well in collaboration with the acute hospital. It is quite right to raise the challenge when it comes to system flow, because it is a significant challenge. We are announcing the data which is being shared, which, as you would appreciate, is as implication in terms of safety, but also as therefore information governance perspective. But you're quite right to actually raise the point of actually adoption, and also how the data and the system that we are going to introduce will be adopted, and how we are going to train the people that are going to use those systems. I think it's fair to say that the challenge we are facing at the moment is actually to find the space and the time for the introduction of that new technology. That's what we are already experiencing. So, for example, staff at the hospital don't have the time to embrace new technology. So we are trying as much as we can to create the space, sometimes utilizing even resources which were part of the CCG or the ADS team to support where is possible, as well those services which are at full capacity or beyond. But is a continuous challenge because of the amount of work which is ongoing. So certainly we are facing the challenge of freeing up resources that can actually work on the new ways of working, and how therefore the technology is going to help on the new ways of working. And that it comes also with challenges to change as well, because as you would appreciate, when you're used to use a certain number of systems, even if they're not optimal, at least you know how to use them. And if you're lacking of time, therefore it becomes challenging to actually find the time to move to another system. So we have commitments from all the chief execs that we will be working on those. We are trying to also to bring in additional resources which will compensate or back up where we actually have to backfill, where we have actually to take away some workforce in order actually to enhance the way we actually move data. We are bringing in, we are looking at a new solution for a beds management system as well as we speak. We're also looking at, which will help from a discharging point of view. We're also looking at a new solution called Leeds Hospital to Home, which is going to give for the first time where patients are in the process, which we never had, because before, up to now, we actually call each other. So we have people in the Transfer of Care Hub, which will call, for example, other social care officers. And so there's a lot of manual effort which is done. So we're looking at the system which will announce that and will be able to tell us where a patient is in the system. So we avoid for the patient to be lost, but also we avoid also delay to look after that particular patients. However, it is a significant change, because it's not only about bringing in new systems, it's integrating them with existing system, like for example, System 1 or EMIS Web, which are inside the GPs, but also inside the CIS as part of other social care, or Mosaic, for example, for children, and so on and so forth. So it's a significant challenge which will take several years before we actually get there. We have put, there is the CDO working. There is the accountable officer working, chief executive officer, which are both into that. Is something that's really close to our heart. We need to actually solve as quickly as we can. But I'm happy to go into more details. But those are a flavor of the things which we are going to do. There is a lot of work, and the challenge, certainly the biggest one, is not technology at the moment. Is finding the time to revisit the processes, revisit the operation, and then understand how technology can free up some of the time. On the second question regarding risks, it's quite right that we have a challenge in terms of skills and training. We have been doing a number of things. So we are constructing and developing a new digital academy as part of the digital change team, which will be led by Girish Solansky. And we will be doing work also very closely with the Leeds Healthcare Partnership and also the universities. There is a shortage of skills around the country. It's very difficult to recruit at the moment. There are people which are moving very quickly from one organization to the other. Cost of living crisis is making that worse, unfortunately, because a lot of people are moving for a higher salary or for other reasons as well. So we will be working very closely with university, the Leeds Healthcare Partnership, and we will also be creating a digital academy. We have been also liaising directly with organizations like Amazon Web Services, which are helping us to fund dedicated training for people which are coming out from universities. And our hope is that we can inject some of those skills very quickly and therefore retain for a number of years actually the resources which we need. The other risk that was mentioned, it was about security. It's something that from an IDS perspective, is a hot, definitely topic, but also in light of what has happened in the last 18 months, we have seen attacks to the hospital, but also to Bradford as well. So we are very keen and we are very close to anything that is regarding security. We are installing new backup system. We are actually recruiting a new chief information security officers as well, which will be dedicated to review how we work in the cloud, because moving to the cloud actually is a significant program. The security measure which are in place in the data centers in the clouds like Microsoft and AWS are actually better than what we currently have in the council or in other health organization. So that's one good reason to actually move there. But the risk is actually how we move to those environments, and also the risk will always be in terms of the people which overview and administer those systems. But certainly moving to the cloud will give us an enhanced security compared to actually what we have now, even down to what we have seen last week, heat wave. And we have seen that in some cases, the cloud operators actually have responded much better because let's face it, they have much more resources that they can spend towards their data centers. We are continuing working with BT, particularly in the space of actual infrastructure and enhancing that infrastructure within the city. So that work will continue, and there is actually new work which will come up as well with Virgin in terms of actually the challenges that we have from a connectivity perspective. There are more people working online than what we experienced before pandemic. So I think it's fair to say that organizations like Microsoft and the big utility company and the big telco are also upgrading as we speak their infrastructure. That is why sometimes we say a service actually dropping and then coming back as well from a performance point of view. But rest assured that we'll continue to work on that is key. We can't really provide any different system or make the city all connected if we don't have a solid infrastructure. So that's something we will continue to work very closely. In terms of agile mindset, that is something that is a journey. It's fair to say that we started with a couple of things last year. For example, the introduction of Microsoft Teams that has seen an agile ways of working. So we pushed it out quite quickly because we needed it from a pandemic perspective. And that is something that Claire Grandin, as part of the head of portfolio management in the IDS team, will be taking personal responsibility in terms of actually helping the training and also the coaching through some external partners to the IDS side, the technology side, but also outside the IDS side to bring in the services, the business side of the authority and beyond as well. Moving to agile is not a simple task. It's actually, when you look at it overall, is more intensive than the traditional ways of working, because it assumes, for example, constant feedback on a daily basis, which helps you to prevent things happening much quicker. And it involves also having clear plans in terms of deliverables. So, but that's something that we will put.
It's normally a test at this time on a Monday morning, so we just let the fire alarm go off and then come back to you. Okay, back to you, Leonardo.
Okay. Yeah. So the move to agile is a mindset, first of all. And there is a process as well, which we'll go through. We started actually the implementation of system like resource allocation last year through a system called Adaptive that has gone operational in July this month. That will give us a visibility of the entire team of 500 people, both in the authority and ICB as well. But there will be more things aligned to that. The prioritization definitely is going to help us on that. And we have recently also partnered with a number of organizations which are helping us to provide additional resources in an elastic way, which we will use to actually ensure that we can cope with the volume of work which is coming towards us, which is quite significant in terms of digitalization.
Yeah, just a couple of things. First of all, good luck with the patient assimilation work that you're doing. Given my sort of history of it, I think you did touch both on, I mean, really key risks are the human factor and infrastructure. And I'll give you just a couple of ideas, a couple of examples. Came in this morning, couldn't get into my iPad because room 6-7 Wi-Fi wasn't working. Fortunately, the Leeds free one did come in about 5 minutes later or so. I've had I get exceptionally good service, as you probably know, from the help desk and all the rest of it. But I quite regularly am told by the people that I'm dealing with that they're not experts in iPads, they're experts in sort of laptops. And of course, I work, in fact, I've got both now because I had problems with sort of either. And I was also told that if people are working from home, a lot of the issues are around the strength of broadband Wi-Fi and all the rest of it. And specifically when someone's trying to access your computer or whatever it is, your device remotely, it can take a lot longer to actually do. This is linked with the next item on the agenda. So I don't know if you're hanging around for it, you know, but I hope you are. Unless we get those basic things right, and I mentioned the Teams meeting I had with Richard last week, that the whole thing falls flat on its face. You know, if you want to continue with a 50% working from home, 50% here, if the IT systems aren't working, then thank you and good night. Doesn't matter how brilliant they are and all the rest of it. You know, just a comment. You don't need to come back. You know.
Yeah, let's take as a comment, but maybe you can address that in your opening remarks with Graham in the next item on agile working as well. Is that okay? Just because we are talking about agile working specifically next. Do you want to make a brief comment? Yes, okay.
Yes, a list on the iPad side that we can convene. The authority has been always predominantly a Microsoft shop, but we have now started to introduce MacBooks and iPad officially. So we are probably weeks away to launch a dedicated service for Apple that will cover not only iPad, but also will cover MacBooks. It is a transition because it requires new skills and it requires also buy-in from staff, which I'm not always. There are people which love Macs, and there are people which loves Windows, and we're also going in the future to introduce Chromebooks as well. So we want to enhance the type of skills. So that is definitely coming.
Yeah, you can see by looking at me that I'm rather ancient. I just hope this long journey doesn't take too long because I might be around to see it.
Thanks, Councillor Flynn. Okay, I'm going to bring in Councillor Almas next.
Thank you, Chair. I think you answered some of my questions and concerns around cybersecurity and around the backup plan as well in your detailed response. But of course, you know, sometimes you need a backup to a backup as well when you're dealing with the, you know, digitization of everything and moving the data and so on. Really welcome the investment into connectivity and infrastructure. However, just a couple of quick comments in terms of the gigabit capability vis-a-vis optic fiber. I mean, the world is moving to 6G and perhaps 7G, and we're still trying to target ourselves into 5G connectivity in terms of networks and so on, because it is, you know, in terms of the the fiber speeds that we're talking, the gigabit capability and all that. It is a bit of a race, like having car companies producing cars, that do 300 miles an hour. But who uses them kind of cars? So in terms of compatibility of the hardware to the speed, what sort of investments have we got there in place, or what are our plans? And I think 5G is a little bit too outdated as well. I think if we really need to invest into infrastructure, I think we should be looking at 6G and beyond, with organizations like Huawei and whatever, because I attended some of their presentations and whatever you. But then again, you've got all the other risk factors and so on as well. But the other question would be, what sort of partnerships have you got with in terms of cybersecurity, like the GCHQ and other partner organizations who would be very useful in terms of making sure that we are resilient in terms of the risks and so on. So yeah, welcome, the initiatives and investment, but what investments have we got in place? And also talking about homes and upgradation of that, of technology, and enabling 90% of homes and so on to have super fast broadband. It's great to have that, but I think if we have the wireless connectivity in terms of 5G, 6G, to me that would be more important going forward, rather than the actual optic fiber. So optic fiber is more useful to, for example, a building like this and whatever you. But in general terms, I think some organizations are over investing in optic fiber, which will be thing of the past. It's like us having all those lights, and the world has moved on to LEDs and stuff like that. So that's my comment on that. I think we need to look at what the world is doing as well in terms of technology. And we've got other issues like data poverty and all the rest of it that's kind of interconnected to when you talk about optic fiber and so on as well. Thank you.
Thank you very much for the questions. There is actually a lot of work which is undergoing. This is why I also taken the decision to create an innovation team inside the digital team, which we didn't really have before, which will be looking at things like the one you mentioned, but also others which are coming. Particularly things even which are not related necessarily to the connectivity, like edge computing, for example, which is kind of normal nowadays, but not for us in the authority, right? So there is actually quite a way to go. And certainly one of the direction I've given to the team is to be cloud first, but also mobile first. Because if you are mobile first, it means by default, you need to have a reliable connectivity anywhere, wherever you go, so that you move. So that is something that we'll definitely expand on, and we are looking at. And we are doing it at the moment with Virgin, with BT and other organizations as well. But we're also tapping into some of the infrastructure work with Amazon Web Services as well on that. That will move inevitably some of our infrastructure in terms of where we have our data center to the cloud. That will help us a bit, because we do have some outdated infrastructure. So we can't even, in some cases, we struggle to cope back here at base, regardless of outside. So we are reviewing all of that as well. Happy to go into more details. We entered the technical side of it. So we are definitely working on it. We are announcing with the work on mobile. We are announcing with the work of innovation. We're definitely working with Virgin and BT and a couple of others of organizations as well. For example, you mentioned the archiving bit. We are covered actually from an archiving perspective, but where we need to go is actually a different place, is where you can restore on demand very quickly. Because at the moment, actually, although we have archiving, it actually takes a little bit longer, which then enables the way that we actually operate within. It's not good to have a lot of fast connectivity if the system from an infrastructure perspective actually cannot cope with it, right? So it's a little bit of a balance. So what I need to do is actually announce the basic infrastructure, announce the data centers, which are moving into the cloud. We are revisiting completely the provisioning of mobile phones, which therefore will enable some of the technology that you already mentioned. In the past, we had a view in the digital team that we would actually buy a number of devices and and we'll keep those devices for as long as we could. I changed a little bit there. So we buy the minimum number of devices, and we constantly look at new devices, new connectivity on a quarterly basis at the moment, and that will give us that change that you're actually asking, you're looking for. So I think it comes with not just the technology you just mentioned, but also what is next coming. So I changed that ways of working now. So I think that will actually bring in some of the technology which you actually mentioned, and some new ones as well. I can't forget that requires new skills as well, which is connected to one of the previous points. And that's why we want to actually create a digital academy, which I mentioned earlier, which focus a lot on mobile technology and a lot on mobile skills, because we need to move away a little bit from having a lot of centralized system in one place. We need to move to a more connected way between everybody. That is yet to come. We are actually training staff, but of course, some of them actually needs to become familiar as well with the technology. That's why sometimes they actually say, oh, we were not the expert either, right? So that is in plan as well. So we have a partnership with LinkedIn for a training and academy. We are going to partner also with Pluralsight as well, and others organization as well. And certainly we are pushing a huge amount with Apple, Microsoft, and AWS and Google at the moment to actually ensure that they give us the support. And in doing that, actually, what you can find out is sometimes you have funds available, which the cloud provider will provide for us to actually move to that new technology. So some of the things that you mentioned are already underway, but what is more important is actually not the infrastructure in terms of technology, the infrastructure in terms of people, operation, the processes, which we are actively working at the moment, which needs to be there in order to support that ways of working, which you are envisioning, which I fully support.
Thank you. Have you got a follow-up?
Yeah, just comment. I think 2026 seems, only a couple of years away, but in terms of technology, it's like centuries. So we need to be very well prepared. I think there's a lot of hard work, and I really welcome your comment around academies and training the people. I think that would be great. Thank you.
Thank you, Councillor Almas. Okay, Councillor Carlile.
Thanks, Chair. I'll make a couple of comments and then a question. I mean, one, that point of training is really useful. Before this, I was a digital director at a small agency, and there was always a huge gap in staff. Well, obviously, those of us that, I mean, I'm old in terms of this world and I'm not 40 yet, but I had to retrain myself every 2 years to try and adapt to everything. One of the real struggles we had actually being in Leeds is there are some of the big companies, you'd get somebody trained up and then you'd have an excellent member of staff, and then Sky Bet would offer you twice as much to go there. I imagine that's still going. So that work around Digital Academy is great, because then we were focusing on really forward-thinking colleges that were bringing forward people with the new skills of the future. More of a mindset it is than actually training yourself on the technologies now, because it's a mindset of constantly innovating that you need to be in that. So that kind of Digital Academy is really worthwhile. I do have a concern that we'll end up losing half the people that come out of it at the end of it, but we'll see what we can do around that. Obviously, it'll benefit the city anyway. Quick touch on the work to get super fast connections to homes, because I think when City Fibre started doing their work across the city, probably all of us as elected members had concerns come through around them digging up pavements and not necessarily putting them back as they were. But I mean, I'm taking benefit now, and I know a lot of other residents are, of the fact that my broadband is now half the cost that it was previously, because previously I was paying for a huge package from one of the main providers, and now I can get it straight to my house for a lot lower cost than it was before. So I think that will really, in this cost of living, hopefully impact people who were choosing to get rid of the service because it was there. I guess the main thing I wanted to pull out on the report in terms of a question was the focus on 100% digital leads, which I think is probably, in my view, the most important bit of the report. I was at a consultation event this weekend that was an in-person one where I was speaking to a couple there, and they were thankful we'd gone to speak to them in person and had surveys for them to respond to on paper, because they find it really difficult in their lives with this transformation that's going on. It's fair to say their issues weren't with the council at all. It was around the rest of the sectors and their lives move into this digital innovation. I think banking was obviously one they brought up, and unfortunately they were finding it difficult to pick up on those skills with that. So that person-centered approach to not factoring digital only into services is a really useful one. But I just wondered, around that 100% digital Leeds program, what are the next steps and the focuses of that going forward? Because it's certainly something that I think is desperately needed in all areas of the city.
Okay, so in terms of you're quite right. There is a mindset that we need to look at when it comes to actually training, particularly when it comes to new technology. Definitely, as I mentioned earlier on, we are going to working very closely with the Leeds Healthcare Partnership and the university, etc. One of the things that I see compared to the private sector is that sometimes you have much bigger opportunities in the public sector to work on larger programs, which you might not always have when you are in the private sector, and I come from the private sector. So unless you join an organization which are rich from a capital and revenue perspective, you don't always have that opportunity, although you might have access to a higher salary, bonuses and things like that. So that is something that we are going to use to our advantage, because the introduction of some of the new technology like the bots recently, or the move of the website to Drupal, etc., will be things that you don't always have access, depending on what organization you actually join from a private sector perspective. But inevitably, yes, there is that risk that will train up people and then they can move on. But hopefully we'll embed them by them. We are looking very much at the culture as well within the digital team, how important that culture is in terms of fulfilling yourself, looking at other things from a technology perspective, what else you want to achieve. So hopefully we'll do a good enough job there to actually ensure that we keep as many as we can, but inevitably there is a risk, not only for the public sector, it will be also for the private sector as well, because some of them sometimes jumps between one to the other to look at opportunities. Salary is important, but also what becomes very important is fulfillment as well. Particularly with people which are working in technology, they like to try new technology, they like to try new things, etc. And that's something which we will be definitely playing at. We are in a unique position at the moment where we are doing a lot of digital transformation, and they should give us actually enough momentum to bring in more people. And as we do that, we need to work to ensure that actually we keep those as well. It's not just digital, it's the all authority effort in terms of how we, work between services, what other opportunities we will be giving to those people which are working on those new technologies. So that's something that we will continue to work on. From a 100% digital inclusion, you're absolutely right that we can't focus only on digital. And also when it comes to digital, there are different channels as well. We were having a meeting actually, I think a Thursday with Councillor Cooper, where we discussed that not only we are trying to push to online, but we will be also looking at channels like Instagram, social media in general, but we'll be looking at phone, text. So a lot of different other channels, not just the common ones like go online. So we will be able in the future to do, for example, services over text, which is something that in China they do predominantly. So as part of digital inclusion, the work we are doing on the web, on the contact center, etc., we will be looking at a number of channels that you will be able to utilize to actually conduct transaction. So it will be phone, it will be online, it will be text, and then of course some of those will be reachable via an handset if you have it, or through other location where we provide the access point in terms of services. Last year, I have asked the infrastructure team to redirect the effort in terms of recycling, for example, all the laptops as we move on to actually digital inclusion. So I made actually that 100% digital inclusion in charge completely of that scheme, so that they have a better handle in terms of what resources they can provide actually to the people in needs. As well, I have opened up a number of other avenues in terms of linkages where we can get additional grants and funds to that team so they continue that work. We are in active consultation and work with some of the big telco, which I remind them every month in terms of providing better services, cheaper services, but also access to, for example, devices like handset, where you'll have the handset free, but also the package free in terms of data, which will allow that connectivity. So that's something that continues. One of the things which is coming next is more attention to actually the ROI in terms of what we invest from a digital inclusion versus what we obtain. And that's something which we are working more actively. There is so much work that sometimes it's easy to forget to measure exactly what is the outcome. So in terms of your question, what is coming next? Apart from everything I said, there is a lot more emphasis on have we made a difference and how do we measure that?
Thank you. Councillor Cooper, do you want to comment on this item?
Yeah, if I can just add to what Leonardo's just explained there about the next steps. I think it's important that we recognise 100% digital as an ambition, and that it's an ambition to offer 100% digital. It doesn't mean to say that 100% of the people will take that up. But actually, if we can make that offer realistic to people, including training and access to hardware as well, such as iPads and so on, which is already happening in our neighbourhood networks, it's happening in the libraries and the community hubs and so on. So if people actually want to take up that opportunity of becoming digitally able, and it can be done at all ages, of course, then that's available for them. And that's the point of the 100% vision for 100% digital in the city. Thanks.
Thank you, Councillor Cooper. Councillor Kelly, have you got a follow-up?
Just a quick comment, really, because I was going to bring it up later. Thanks for that, and that's really useful. And I know the work on the devices, well, that's something that we all saw in the pandemic, wasn't it, where many of us were then supporting kids without any devices at all to have something for learning through. Based on just the comments around looking at the return on investment and that and meeting the objectives, I wondered if it's something we could look at as possibly something in the work programme for the next year, to look at how digitally included different areas of Leeds are, see the work that's going on and really have a focus on that. Because obviously, if another crisis like we've had over these last few years comes on again, it would be great for us to know what better place we're in. I don't know if that's something that's arranged to be in or not.
Thank you very much, Councillor Keller. We'll discuss that in the last agenda item work programme. Okay, thank you. Councillor Burke.
Thanks, Chair. I think Councillor Cooper's just kind of answered really what I was going to ask. We've talked a lot about technology this morning and very little about people. And actually, the people are at the core of any strategy, no matter how good our technology is. So I just want to ask about inclusion. The report, it does talk about some of the common links and how it's complex, but it doesn't actually detail how we're going to overcome them. And I'm saying we, how we're going to jump over those barriers. And you're right, the barriers are very complex. It references 100% digital Leeds, and Councillor Cooper's very helpfully just listed the outlets where that it does work very successfully, but there's still a huge chunk of people outside that circle. A lot of them have disabilities, physical or mental incapacities, and I just think there's a whole host of people that we're in danger of leaving behind. Now, that's my first question. As we move to more digital, and I welcome it, that's got to have an impact on the staffing levels. It just must. So do you have a target around percentages? What do those reductions look like? And are they reductions just in an area, or do you intend to move them somewhere else within the organisation? And there's systems like now, if someone's bidding on a council house, I regularly am talked to by residents about how difficult it is doing things on your phone, because that's all that got, and then it eats all the data up because they don't have the money, and so on and so forth. So I think I'm not sure it's a question, it's maybe a comment. We need to be mindful about the barriers, and I do accept that you are.
and how it impacts on different sections of our society, and not to leave any of them behind, because we're in danger of developing a two-tier approach to things, really, aren't we? Thank you.
Steve?
Yeah, thanks very much for the question. I'll pick up the who question, and then I'll hand over to Leonardo for the staffing question, if that's okay. You're absolutely right. The strategy, as I mentioned earlier, has been written, from a person perspective, and in terms of engaging with people in terms of writing that strategy, that has been a collaborative approach. So Leeds City Council, CCG, the wider Leeds Health and Care Partnership, which includes third sector community groups, those kind of groups as well. I think we can learn as well from the good work that 100% Digital Leeds have done and the approach that they have taken, because this isn't just about Leeds City Council doing stuff with people. This is about working with those community groups who are already working with those groups who we might not necessarily be connected with directly. And almost that train the trainer approach, if you like, that we're working with the groups who are connected with those people that maybe we see as, in inverted commas, hard to reach, but they're not hard to reach at all. They are living and working in communities. We just need to work with the right people to work with them. And I think, in terms of the broader work that we do and the innovation work, for example, that is very much about taking that person-centered approach. It's important that if we're doing any innovation work about how do we co-design our services in the future, that it's important that the people who will access those services are involved in the conversations right at the very beginning, because ultimately they will be the recipients, if you like. So absolutely, anything in terms of the innovation labs that we'll be running and all that kind of work, very important that members of the public, that we reach out through our networks, and we reach out to people and encourage those members of the public who will be accessing those services to get involved in this work. Yeah. Can I just one other point I was just going to mention as well, in relation to the 100% Digital Leeds work, was just to make everybody aware, there's a very comprehensive report that goes to the Infrastructure and Inclusive Growth Scrutiny Board. I think it's about April time that goes. Very comprehensive report for those that haven't read it, so worth a look.
Thanks, Steve. And I'll ask Becky to circulate that because it came early in this year. Councillor Cooper, do you want to comment? Yep.
Yeah, can I just add to what Steve said before Leonardo comes in? Really, now I was going to reference the reports that actually go to a different scrutiny board on 100% digital work that's happening. But it's probably useful for scrutiny members to see those reports and see how they link into the digital strategy as well. It should be no surprise to anybody here that there is an issue with digital poverty, not just in the city, but nationally as well. I dare say internationally, and within our own city boundaries, it should be no surprise where the areas are that we suffer most from digital poverty as well. So 100% Digital is working towards addressing that through the work that they are undertaking. But it's it's our deprived areas where people are suffering already from poverty of other types as well. And so it's not just around digital poverty, but they seem to suffer poverty in every respect and theme that we can put it in as well. The Leeds City Council, alongside the 100% Digital, are doing an awful lot of work to address that poverty in those areas, particularly through our commissioning and also through our third sector providers in those areas, as well as through our own outlets that I mentioned earlier in answer to Councillor Carlisle's question. I just wanted to make that point for Leonardo.
Thank you. I'm going to bring in Neil and then Leonardo.
I was actually just kind of come in on the sort of the budget issues and sort of staff shifts. So I mean, we've lost a couple of thousand staff over the last decade in response to sort of financial challenges we have. And looking forward, we said next 3 years we've got something like a £60 million gap. In reality, that's going to grow. I mean, our current budget is based on a 2% pay rise. I think probably all believe that it's going to be higher than that. 1% is about 4 million for the authority. Our budget was also set pre-Ukraine, so actually it was based on the energy prices last year, not these. So that figure is going to grow. So, I mean, one of the principal ways in which that is going to be addressed is by lowering the pay bill. Given that actually pay will actually increase, that means actually it will mean lower numbers of staff. Now, the only way to sort of try and protect public services is to look at those things which we can automate and do differently, which will, release those people without impacting upon the public service. And take an example, 2 examples. If we move to the cloud, then actually there are staff who will be maintaining the servers and all our internal side of things, which will not be required in a few years' time. We're going through a big transformation in finance at the moment. We produce hundreds of spreadsheets and sort of give it out to people. Actually, the core business transformation will automate that, and will mean that people leave. But what I would say is that is in the context, and it's in some sense it's a good thing for us at the moment, that actually there is a real recruitment problem, and we're going to come on to that later on. So actually, this will actually, I think, help us and enable us deal with the problem of actually recruiting people. So we are, considerably short, for example, in business admin at the moment, but we can actually maybe solve that problem, not by further recruitment, but by actually dealing with it through automation instead. And where there are, I think maybe, in something like finance, there may be some issues around, have we got too many people? Well, actually, there are other places then, like business admin, where there are opportunities, which gives us a challenge of retraining and so forth. But I think that the way that things are set up, it's coming at a time where we can reduce, but through natural wastage and through retraining into areas where we are really suffering from problems of recruitment.
Thank you very much. Do you want to add to that, Leonardo?
I think Neil covered most of it, but in terms of digital transformation, actually there are 2 aspects. There are, of course, as you do digital transformation, there are, of course, the people which are working in digital, which will be impacted, and there will be the people which are actually providing a service for which you have automation, which will be impacted as well. So Neil made some example in finance already. Cloud is another example, as Neil has just mentioned, in terms of some resources will not be needed in 2 to 3 years' time as part of that movement. Another example is the work which we are doing in the contact center. As we go through that transformation, as Neil said, it will help us definitely from a recruitment perspective, but also it will give us an opportunity to relook at what services and how we use our people as well. So because it will move away from admin type of tasks which are done in an automated fashion to different type of works, which will be more the inside type of work, which will bring actually some of the officers closer to the services, closer to the people, which is the element also you mentioned earlier on.
Thank you. Do you have a supplementary? Yes.
Thank you. A comment and just a further question, if I may. I think the work that 100% Digital Leeds do is fantastic. However, there's just an issue about sustainability in my head, because a lot of the offers that they give to people or the enhancements are for a finite period, either. So you might get free access for 6 months. And as it's a comment, I don't require an answer, but as the cost of living increases, then pressures on people are going to come worse. They may become accustomed, and then there's a cut-off point. So perhaps that's just something to think about. And my question is, I'm not sure it's a question, it's maybe a plea, is not to forget members in the design of training and everything else, because members are the people who are actually dealing on the front line as well as other frontline staff. And I think sometimes in and amongst elected members could perhaps fall off the cliff. So perhaps we could be fully included in any training and development design that's going on. Thank you.
I assume that's a yes. That's okay. Good. Okay, great. Okay, Councillor Ritchie.
Thank you, Chair. My question is around the digital Leeds labs, which brings the people element, doesn't it, into accessing services and what have you. There are a couple of examples that are described as successful solutions, the bin app and the Leeds social housing picker. I just wondered if, a bit like an old report that used to go on a dusty shelf, a successful solution is not just left at that, and it's looked to add to and enhanced and promoted continually, and that you monitor usage and downloads, locations and so on. I'm particularly intrigued by the Leeds social housing picker. That's not one I've actually heard of. I've heard of the bin app, and a lot of casework is around the challenges of accessing even the current online bidding. People still hanker for the old newsletter that were in the hubs every week and what have you. So it would be good. I know it's probably not for this scrutiny board, but a general briefing about that and how that's been promoted and what that can offer our constituents as well. Thank you.
So you have to provide a briefing to the board through Becky on that specific issue. Is that okay, Councillor Ritchie? Yep. Okay, thank you. Councillor Gruen.
Thank you, Chair. It was a surprise to be placed on this scrutiny board, and surrounded as I am by such knowledgeable councillors and officers, I think you can look forward to the sort of idiot-proof questioning from me on this scrutiny, but there's a place for that, isn't there, really? Many of the things that were going around in my mind as I was reading this paper have been dealt with, and Councillor Cooper, your comments were really, really helpful. But just to give you a feel of what's going on in my brain, the digital first but not digital only did stand out of the paper when I was reading it, and you chose to begin your presentation on that note, actually. But having said that, I just wonder how you see and where you see the face-to-face opportunities going alongside the digital approach, because the table on page 16 clearly says the 100% digital Leeds as the world-class sort of solution, and refers to paperless. So my first question is, how do you weave in the opportunities for non-digital with the digital move? And my second question is, how practical do you feel a paperless environment will be, and is it entirely desirable? I particularly welcome the work that's been going on with dealing with cyber attacks and the Digital Academy. And can I make a plea that the Digital Academy is accessible to all ability levels and starting points, please, because I think that is absolutely crucial. And the other thing that you mentioned earlier in your presentation, you referred to the digital and data ethics. Well, I think I know what data ethics are, but I'm not sure I know what digital ethics are. So perhaps if you could either explain a little bit more about that, or again, provide a briefing in some other format for me on that. I'd just like to come back on Councillor Flynn's point about iPads. There is a physical accessibility issue as well. Since I had my surgery on my back, I can't carry heavy items very far. So I do need access to something that's portable, which does mean that I do need an iPad. Now, the planning service has recently started publishing papers for councillors in a format that can't be accessed on an iPad. They are working towards it, but currently you can't access it on an iPad. So it does need weaving into the warp and weft of our service. It's crucial in my view. Thank you.
Thanks very much for that, Councillor Gruen. So just to cover off some of those areas, I mean, in terms of the paperless environment, I think this is as much as anything about how we work internally, really. If there is a form that a customer wants to fill out and that's a paper form, then that form should still be available. And that's that kind of traditional methods, that's face-to-face, that telephone contacts, that is still available. But I think where we can digitize our services, then that's what we should look to do. For example, with the housing records, you know, rather than having cupboards full of old paper records, let's scan those in and let's digitize those. It makes them more accessible and easier to find information in the future. So I think that's the point there. And I guess so it's not about shifting everything online and sort of eliminating analog services. Where those services are still required, those services will still exist. And what we're doing here in terms of that diagram on page 16, moving from sort of traditional setting, if you like, through to a transformed organization is as much about how we work and some of the complementary digital services that we deliver. I'll leave it at that for that, and Leonardo might want to add to that. In terms of the ethics, I think this is just to think about, you know, not just about the data that we collect, you know, and you know, it's about, well, the data that we collect, where we store it, how we store it, about bringing in the information governance aspects to all of that to ensure that we're compliant with data protection, for example. But I think as well, you know, in a world where we'll be collecting increasing amounts of real-time data using Internet of Things devices, it's thinking about, you know, where those devices come from, who are our trusted suppliers, how are they built, and what data are they capturing, and all the rest of it. So I think it's the whole digital and data ecosystem that we need to be thinking about in terms of ethical use of technology, rather than just the data that we're collecting.
Yeah, a couple of addition to that. I agree 100% with what Steve mentioned. It's about not replacing all the analog services, but is to complement them. For example, if you want to perform an online transaction at 11 o'clock at night, you can actually do it without waiting the following day. It's something that, you know, we need to, the world is moving towards is that convenience, right? And there will be particularly the new generation are onto it really very much. There is a lot of work which we're doing on mobile, and the iPad is part of it. We know the iPad as an ecosystem has its pros and cons when it comes to actually incompatibility, and we are revisiting all of that, but it's a quite significant amount of work in terms of actually ensuring that some of our system actually work on those new generation of devices. For example, our current finance system, which is aging, which the CBT program will be replacing, currently will not run on a MacBook, on an iPad, and there's not much we can do about it. However, the new version will. So we are actually moving towards it, and that will give also more choice in terms of devices, particularly when it comes to the mobile phone, because it's easier to provide actually than a laptop, particularly where there is a need of devices or where the 100% digital inclusion actually is working on. And one of the things which I have asked the team is also to work on, which is part of innovation, of the potential in the future to replace the laptops with mobile phones, because this mobile phone is in Samsung S22, actually can run as a laptop on itself. So there are things which we are actually looking in terms of an innovation point of view. The point on remembering also how members work, it's important. It's about user experience. I have asked the service desk team to assign a person dedicated to members to provide that service, but we need to look more and more the user experience, which in my view probably needs to become more mobile than what we currently have at the moment. So we are working on that as we speak. As I just mentioned, there will be opportunity to even use in the near future our phones as laptops, really. In terms of sustainability of the 100% digital team, which you asked earlier, this is why I went to the executive management team of the ICB and I asked that they appoint that team also to be the same team that provide 100% digital inclusion to the health side, which they have accepted. So I'm thinking about broadening up where I can get funds, access to funds and grants to maintain their sustainability. So I'm trying to widen it up, not just from an authority perspective, not only from a city perspective, but also regionally as well, and a lot more on the health space as well. Additionally, with the work we are doing in city development with Eve Roodhouse and others, we're actually announcing that through also the private sector as well. So where we actually ask private organization to come in and support that. And an example is the telco, where we regularly ask BT to provide not just grants and access to funds, but to provide solutions which are free of charge for where there is, for example, poverty in the city. So it's definitely something which we're actively working on.
Councillor Cooper.
Thank you, Chair. Just wanted to add slightly to what Leonardo said, and in terms of the people side of things that you raised, Councillor Gruen, as well. I think it's really important that as an organisation, Leeds City Council enhances the way that we engage with our residents and our customers, and also opens up easier ways of access to us, to the people of Leeds. So, you know, for instance, I know from you just do the family and friends test yourself, don't you? In ways that how would people like to access the council? Well, they'd certainly rather be able to do it either online or through an easy portal, whether that be social media or in another way, and to be able to transact themselves without the necessity to ring on a phone line and and expect somebody to walk you through whatever those steps might well be that you need to undertake. So if you need to make a payment, you need to ask for advice or things like that. If you can do it in that way, and you can access it that freely 24/7 without waiting for phone lines to open and so on like that, then that certainly will improve your experience with Leeds City Council, both as a customer and as a resident. And so I think it's really important that we do that. I think it's also really important that we don't exclude anybody. And as Councillor Burke mentioned earlier, the last thing we want to create is a two-tier system where only certain parts of our communities have access to us as an organisation, which is why we're trying really hard to ensure that we do this with the principles that are written in the report about how we take these things forward. Thanks, Chair.
Thank you very much. Do you have a supplementary? Yes,
it's not a question, it's just a comment. Thank you very much for those helpful remarks. And on the digital accessibility issue, we do have a mountain to climb, don't we? Because we earlier said, well, for example, the hubs are providing digital access, but it's so partial, even for those who choose to take it up. I mean, Councillor Ritchie and I know a resident who goes into the hub every morning to engage with the computer, do his emails, contract business, whatever he's doing. And then 40 minutes later, he leaves the hub and he doesn't interact digitally for the rest of the day because he hasn't got a computer. Now, we are all interacting digitally all day long, on and off. That's why I need my portable iPad. But for him, he has 40 minutes and then he doesn't do it again all day. So that's not 100% digital access, is it?
Thanks, Councillor Gruen. Councillor Firth, do you have a following question?
Thank you, Chair, and I'll be quick. I appreciate time is against us. I just think I'd just like to make 2 quick points. The first thing is that actually, absolutely, we need to prioritise those who are in deprived areas in terms of digital accessibility. But I also think at this point, it's also the fact of access even in our rural areas, for the fact that we have, particularly in the outer northeast area of Leeds, particularly Harewood Ward, which I obviously represent, and others in the more rural areas that don't have any access hubs, and also an older demographic, which as a result potentially means that the digital skills are not as much available as even accessible. So certainly that's something. And also I think that the wider picture of that we're in at the moment, of the fact that, as has been raised at previous meetings, when we're having average wait times of over 12.5 minutes for people to be able to get through on the phone, that is largely due to the fact that people are not able to access things online. And as a result, the integrated way in which we need to make sure our front line or front facing accessibility is absolutely critical that we improve it as soon as possible to enable us across the council to be able to deal with and satisfy the needs of our residents and customers. I just wanted to ask one quick question, which is about the fact that as part of this process, we need to recruit at least 110 new staff to be able to deliver this wider programme across the IDS. In a market that is largely candidate driven at the moment, and salaries are skyrocketing because the skills are so finite and so competitively required by so many different organisations across Leeds, can I ask, where do we stand at this current moment in terms of, are we being realistic about the amount of money that it's actually going to cost to recruit the amount of staff that we need, and potentially is that something that we need to be looking at further to inject further money in the future? Thank you.
Thank you for the question. It's quite right. It's a significant challenge in terms of recruiting in the current market conditions. But this is why also I have taken the actions to partner with two organizations which are based in Leeds. One is called CGI, which does a lot of work in the public sector, and one which is called UST, which will provide resources in Leeds or near shore as well. We will use those organizations to compensate with the challenge that we have on the recruitment side. And as we progress in that program of work, we might have to rebalance it based on how quickly we recruit in terms of what will be the final number of resources that we recruit. So we realize of the challenge. That is why we have decided to actually partnership with two organizations which have access to a large number of resources that will help us through that digital transformation. And as I said, as we go through it, we may have to make some adjustments, which hopefully will be on maybe reducing the number instead of 110, because we realize some of that digital transformation through a partner maybe. So we are looking at not just relying on the market condition, but also on partners. Of course, HR is working actively on a marketing campaign as well for bringing in people, but it needs to be a bit of a combined approach. And there are some uncertainty, of course, as other organizations are experiencing.
Councillor Cooper.
Yeah, thank you, Chair. Just a couple of additions to that, if I can, Councillor Firth. I know that 100% digital are also looking at the outer areas in terms of accessibility and connectivity as well. So, you know, that is not being forgotten at all. It's, you know, 100% digital offer is 100% digital offer to the whole of the city. I think also you quoted a 12-minute average wait currently for the contact centre, which is not the current waiting time at the moment. I think you're using figures from a previous report to Scrutiny maybe, or you know, earlier figures. I had a meeting last week with the contact centre, and that figure has improved, and I'll ensure that that the current figure is circulated to Scrutiny Board members after this meeting, Chair.
Thank you. Neil?
Just on the resources side, picking up Councillor Firth's point, so we have put in a substantial amount of money through using capital to support transformation work, so you can use one-off if it's going to lead to savings longer term. So we put in around 3 million on that basis. I think that's, whilst there are always going to be limitations to that, I think actually where there are strong business cases which show that an intervention will make long-term sense, we can be flexible about that. So we won't be turning down really sensible things to do which are going to save us money long-term if we need to finance them with some one-off resources.
Thank you. Councillor Firth, do you have a follow-up?
Thank you very much, Chair. Just to clarify, the 12.5 minutes was on medium priority calls, and I understand that the average wait time is just over 10 minutes. So I appreciate that that is certainly the figures, but as we've discussed before, and we won't go over it again, we all want it to improve because it will help us in terms of our service delivery. I think that the nature in terms of, and that figure obviously was from up to March this year, and I haven't seen a figure since. So I look forward to that in due course. The question I was going to ask is how regularly are we benchmarking ourselves across the city and in the region to make sure that our offer of pay is as competitive as it can be? And if not, what benefits are other organisations also offering in addition to salary that potentially we can compete with?
Can we take this in item 9 for retention and recruitment? Is that okay? Councillor Firth, I'm a little bit surprised that you didn't make that point about medium priority calls when you spoke about it at full council. I think it certainly wasn't clear to me, so I'm a little bit disappointed by that. Just closing remarks on this item. Just some comments, I think, really. So I think really important to limit the number of apps that we have. I think you've said that in the report, and I think the only way we're going to keep moving forwards is if we, particularly with the recruitment challenges that we have, is if we don't bespoke everything. So keeping it simple and making sure we can work to what's out there. I think we'll all agree that the recruitment and the financial challenges around this area are really pertinent to this conversation. And I guess hopefully as a board we can sort of highlight this is an important area to keep investing in. And I think if we don't invest here, all our other services across the city, across the directorates will suffer. So it's really important to make sure as a council we focus on that. And I think hopefully everyone can agree on the board that is it. We can see that as a priority in terms of a scrutiny recommendation. Everyone appears to be happy with that. So we'll close that item there. Thank you very much. We're going to move on to the next item. Hopefully the IDS people stay for this item. And I'm going to invite Graham and his colleague to come and join us. I think Graham will introduce the item, but it'd be great if you and you could introduce yourselves first and let us know what your roles are before we crack on. Just for those watching, extra people are just joining the table and they need their microphones plugged in.
Hi everyone, I'm Graham Sefton. I'm from the HR team and part of the Future Ways of Working project and have been for the last 2 or 3 years.
Good morning, everybody. I'm Angela Barnacle. I'm the Chief Officer for Asset Management and Regeneration.
Thank you very much. As I always say, please assume that we've read the report when you're presenting it. Thank you.
Yeah. Hi, everyone. Just a couple of small words by way of introduction to the report. It's nice to be back at Scrutiny again following last year's inquiry. I think it was 5 or 6 reports that we brought to this group over the last couple of years. And in a sense, today just gives the latest update on the current position. But I realise that some members are new to Scrutiny Board. So if there's anything we can do outside of the meeting in terms of sharing past information, please do shout and we'll do our best to do that. Today, as usual, gives an update around a couple of key aspects. It's in terms of all of our people work and the current working patterns and what we see particularly over the last few months in terms of return to the office. As part of the future working programme, but also we need to remember that it's not just office staff that are covered by our commitment around this, and there's some good work continue to take place around the best place to work pledge for frontline workers. We've got some data to share with you, which you'll see in the report, which is around the latest survey that we did across all of our teams, which gives us our most recent picture around what that return to the office looks like. And also we've got some information in the report around the estate as normal and changes that have been made and continue to be made to make our office estate as flexible as it needs to be as we manage this change programme. So I think today, it'd be good to just reflect on that and get some discussion and your feedback, particularly in terms of the people side. There's some emerging principles around our hybrid approach that are picked up in section 3.14, I think it is, It'd be really good to get some thoughts back on that today. And obviously any questions around the estate, Angela can, more than readily pick up today. Thank you.
Thank you very much. Just to start with, I really appreciated all the reports that came last year, and I also appreciative that this is coming at an early stage before everything's sort of signed off. It gives us a real chance of scrutiny to feed into the decisions, which I think everyone agreed at full council is a really important element of the scrutiny board. So that's really important. I'm going to start bringing in members for questions now. So I'll start with Councillor Flynn.
Hi, Graham. You'll have heard all of these questions before, I think, so no surprises, I don't think. I'd be very grateful as a start if we could leave buzzwords out of it. Team zones, KPIs, plain English will do me fine. Thank you very much indeed. Like the last paper, no risks identified. Just a general sort of comment about the main manager and all the rest of it. If I could perhaps ask in future, when we get papers to scrutiny board, the risks must be clearly identified. Our job is to challenge and not just to sort of go through a paper or whatever. We need to know what the key risks are from your perspective, and we can pick up our own from that. Okay. Second one is, and Graham must say, the no surprise to you in this, I think, paragraph 2.5 on page 29. So far as I can see, there's only one mention in this paper of customers, i.e. the people of Leeds. And the whole point of any of us being here is to serve the people of Leeds. In the best place to work pledge, for instance, not a single word about it at all. I appreciate that this is more about, the staff and so on and so forth, but the whole point of staff being in work is to provide a service to the public. And it's all very well saying how well it's gone and producing stats and surveys and all the rest of it. How do we actually know that what we're doing is still providing a reasonable service to the public? The guys who, refuse collectors, magnificent job over the last 2 or 3 years, given the circumstances and stuff. But in a minute if your bin hasn't been collected, and probably within 24 hours. Why? Because we get an end of day report. Rest of this stuff, haven't got a clue. We just have to rely on people getting in touch or getting fed up or whatever. Third item, possibly more for Neil or Debbie. Debbie mentioned before about the effect of digitalisation on more deprived areas of the city. And I noticed in the office closures that most of those are in deprived areas of the city. And how's that affected the people who actually live there in terms of the council services they get? And recommendations, yet again, not a single word about service to the public. And just a couple of comments really on page 31, paragraph 3.8. There's a table. I'm assuming that should be color coded because it doesn't make any sense at all to me. Whereas I've got a pretty good idea it is when you look at how many people are in on a Monday and a Friday. It doesn't mean anything. And in paragraph 3.11 on the same page, those statistics, I haven't got a clue what they mean. Don't mean anything to me at all. So over to you, Graham.
I think they're all good questions, Councillor Flynn. And I think when we started this whole programme and still do, that idea that service is really crucial. Service comes first. Whatever we do around the future working programme, we have to protect that. And I think you'll see, even now in the latest report, we're looking to strengthen that further. And we're still asking our teams to ensure that's the case and offer that reassurance, through everything that they do, that's protected. I think in terms of the performance reporting that takes place across the council, we still have that robust, mechanism for reporting through other scrutiny channels around day-to-day service delivery, and that hasn't changed in respect, during COVID. That's still there. So those performance updates from each of the teams to various scrutiny boards, I think, is something that happens. CLTs, monitor of all of that, exec board oversight of all that. I think all that still takes place and is showing largely that the council continues to deliver a good service. And we talked previously as well about during the COVID pandemic period itself, how well the council team had done to keep things going and the new work that they delivered and the different work that they delivered. So I think we've got that established mechanism around performance management to fall back on. But I do think, we've talked about at some of our program coordination groups recently about the need to really strengthen that and make that more public and bring that here, for example, to these groups to really show that link between new ways of working and the fact that performance is being maintained. And you'll see in the survey, one of the areas where you said, I'm not sure what the data means, I think was around the ask of chief officers around, do you think that performance levels are being affected for better or worse as part of that latest survey? And that the overwhelming majority feedback from senior leaders was, yes, they do think that at least service has been maintained and often improved. And that was the overwhelming feedback that we had. So in that sense, the people who are day-to-day running the services tasked with that accountability around service delivery are saying back to us that they think it's a positive picture. In terms of the risks, I take your point about the detail not being in this report, but once again, do rest assured that as part of our program work, we've got risk logs that we look at, through Neil's oversight groups, as part of our day-to-day report, and we do have that. So there is a risk log, it is actively managed. We meet fortnightly to look at that. And I think possibly what we need to do is share, some of that detail with you so you can be confident that that's happening.
Maybe comment on a few of the things you've raised, Councillor Flynn. So, I think the principle around how we organise should be based around the public is absolutely central. And if you look at those set of principles which set out 3.14, it's acknowledging in a way that the country has changed. We're not alone. Actually, civil service, other councils, pretty much any office-based organisation has changed in this last couple of years. I don't think that is going to change. But in terms of coming to a formula around what the hybrid should be, then are we delivering as good or better a service? It's got to be absolutely fundamental to it. In truth, it is tricky sometimes to actually determine in a quantifiable way that for every service. So if you look at, processing of council tax or call centre, your favourite subject, lots of things. There are some things where you can look at it, transactional times and so forth, and you can judge, is it as good at home as it is in work? And those things are standing up. It's more difficult, I think, to judge whether somebody in regeneration team does good a regeneration scheme at home as they, those things they're more qualitative sort of judgments, I suppose, and that goes for quite a lot of our services, and that's where the chief officer judgments come in. What I would say to you is, going to the first one about helping us recruit and retain, and we'll go on to how difficult it is at the moment. As you're asking the question, prove to me that it's as good. I've got lots of staff saying, prove to me I need to come in, actually. Well, because actually is the service, going backwards. And I personally believe that there is a need for regular contact because of the kind of quality of relationships between people, development of new staff, good supervision. I think we need all these things to be in person. It's quite actually difficult to do all of those, I think, over in a remote way. But that challenge of showing that those things are necessary is something which actually staff are saying. And you've got people now saying, well, actually, it's, I'm struggling with finances, adding cost of transport and all those sort of things are going to cost me. So we've got your challenge, but we've got the other challenge too. In terms of where we're at, I think the reality is that we aren't going to see a significant shift from where we are at the moment. We may see some more people coming back in September. And I think that, that maybe there will be people who decide actually it's cheaper to come in rather than heat their home. And people are always welcome to come in. And we've said as a principle that people can come in if they wish, as well as if they need to. But it is going to lead to some consolidation of buildings. Now, what I would say to you about some of the things which have closed is that whilst we have many buildings which are about being located where public need access, we've had lots of buildings randomly distributed across the authority which have had nothing to do with that area at all. So if I take a place like Huff Top, which was a old school, frankly, an awful building, which was doing finance functions out of that for years. It didn't need to be there. So I think we are going to be closing some places like that, which are effectively administrative places which we've based for convenience, and we are going to be able to take the opportunity to deal with the fact that frankly we've never had enough money to properly maintain our stock. So all of you will know some of the rubbish buildings, frankly, which we've had over the years. This gives us a chance to actually consolidate in really good buildings and offer, staff really good accommodation, which will also help with things like recruitment and stuff like that as well. So I think it's a really significant time. Work is changing in a way. We've been on this journey for many years, but the acceleration in a couple of years has been phenomenal. I don't think we'll ever reverse it. But this next number of months is quite crucial, kind of working through that kind of what that new pattern will be. But I generally feel being regarding of risks and making sure that people don't get isolated, and we do deal with issues of development and so forth. Nevertheless, actually, it is a positive move, and we can take some real opportunities here to actually improve services and improve the experience of staff as well.
Councillor Cooper.
Yeah, thank you, Chair. And first of all, I really just want to point out that after last council's lengthy scrutiny debate that we had, that actually this is one of those pieces of work coming to scrutiny in terms of the proactive work that scrutiny does. So as opposed to the kind of challenging the decision after, and this is actually, I wanted to bring it to scrutiny to get scrutiny's views and input so that you can help shape and influence policy going forward. So please, I hope you accept the report and the offer of that's been put forward today in those terms. I think it's really important just to answer a couple of points, Councillor Flynn, that you raised, and one about risks. Quite rightly, we need to say what those risks may be, and also how we would work to mitigate many of those risks as well. So point really well made, I think. I think the point you raised about the buildings also is, and on that list there are a number that shut way before 2020, I've got to say. They didn't just shut in 2020, like Bramley Housing Office, which shut as a housing office before 2020. And in fact, we invested in a community hub just up the road from it, a matter of a few hundred yards up the road from it, where those services are delivered face to face. And that's just one example on the list. There are others there. I think Neil made the point that a number of the buildings were in poor maintenance and maybe mostly office space for our staff. And I think we have to also consider, what some of those buildings are like when we're asking our staff to go and work in them as well. So we need to consider that going forward as well. I'd just also like to say that when we do have a building that may be looking to close because the office space is not needed, and perhaps we need to look at it differently, then the way that service is delivered to the community would also be taken into consideration, and maybe amalgamated with another possible area, another outlet that's able to do that, which is one in my ward, for instance, that closed, and that did close in 2020 for the pandemic. But the services are going to be offered in a different way for that. I'd also just like to say we need to remember that as a council, we don't just have people working office based or digitally based. We have a lot of frontline staff that are out there and have been out there, regardless of a pandemic or not, and they will continue to be out delivering those face-to-face services, you know, including all the community hubs, all the libraries and so on like that as well. Thank you, Chair.
Thank you. Councillor Flynn, do you want to come back?
Just a couple of comments, really. Graham, thanks very much for not mentioning KPIs. I know you're struggling to find your way around it there, but staff would say that, wouldn't they? They would say that the service they're presenting to the public is just as good as it was before. That's human nature. What I really want to know is we've done survey after survey after survey of the staff, not one survey of the public about whether or not they think they're getting as good a service now as they were before. Not your responsibility, not your area. I know that. Neil, and I take your point about staff responsibilities. Obviously, you know, we have to look after our staff and all the rest of it, but this is a public service, not a private service. You know, staff can't dictate what they can and what they can't do if we are not providing the right level of support to the public, and we have no way. It's nobody's fault. There's just no way of knowing whether or not the level of service that we're giving is the correct one or not. And just finally, Debbie, the point you made about frontline staff and office-based staff, very well made. Has anybody actually asked? I know this is part of the thing that Graham has been doing. Has anybody asked what the frontline staff view is of hybrid working that they have no chance of actually taking part in? Don't need to answer that.
Neil, can you come in?
Sorry, just I mean on. I won't go over some of the other points I've made before, but just on the last point, I mean, I think what members maybe see in Civic Hall and is a bit different from actually what it is out in the depots. So actually, in general, the staff who are supporting and sort of supervising staff as officers are in work. So actually, you know, things like the LBS teams, the CEL teams, they are around. So because actually to do that properly, you need to be in the office. And what you see is a much stronger match between those frontline services and the office staff that support them than in administrative functions maybe based in the Civic Hall where there isn't that relationship with frontline staff. So I'm not. I don't think that is proving to be a significant issue at all.
Thank you. I just also just like to comment that I welcome your point about some in time necessary. I think particularly for our junior staff and staff that need mentoring, I think face-to-face is a really important process, and just the secondary listening to people on the phone and how they deal with different people is sort of that's sort of absorb it via osmosis and culture rather than necessarily being on Teams. Okay, thank you for that. I'm going to bring in Councillor Gruen next.
Thank you. I feel on the face of it that this paper is common sense. It's where we've got to, isn't it, over the last 2 years, and it's mixing and balancing people's own preferences with what it's practical to have, how many people it's practical to have working at home at any one time, and whether or not there ought to be any pressure to come in or not to come in, assuming the job can be done from home. If I think about my own efficiency in the lockdown, when we all had to work remotely, of the bit of my job you can do from home, because a lot of it you can't, it's about being in communities, but of the bit it's possible to do from home, apart from loathing the sight of my head on a screen, it was more, there were definitely efficiency savings, there's no doubt. We could fit a lot more in. As Councillor Scopes knows, when we went back to normal, I suddenly couldn't be as available anymore for the things I'd committed to. So there was that, and you could look lots of stuff in between that you'd normally be in the car driving backwards and forwards or on public transport. So I learned a lot about working at home. And then when we started to drift back again, and I observed, for example, Councillor Cooper in our own office here, people started to come back a few at a time or a few days in the week, as is described in this paper. It meant that you never got a full complement of staff in at one time, which may well be an efficient way of doing it. But what didn't happen was that buzz of people together. Now, it might be the way that I'm just conditioned, but I actually need that to function. And I think human beings do need that to function. The social side of working, it sounds like a contradiction in terms, but actually it's not. And I think the way people relate to each other in meetings face to face, as we are here, is different from the way they behave on screen. And there's all sorts of mannerisms and expressions and asides and, you know, interludes when you have a word with somebody that just isn't achievable in different forms. So for me, a risk is the sort of staff and public well-being of moving to this model. And I really think we need to consider it carefully. I know some people who became quite depressed during the lockdown period because of that lack of social contact. And even when they're back with real people, the social contact is less varied and with a smaller groups. And that's quite an important human element for me.
Thank you, Councillor Graham. Graham, do you want to comment? And then I'll bring in Neil.
Yeah, I think it's a really good point. And that whole idea of being in for team and the support that you get and the well-being that comes from that and the connections you make. We've heard that consistently throughout all this project, you know, that people really value that, really need it and want it. Hence why from the very start, one of our core principles was everyone will spend regular time in the workplace. And that was because of team and everything you say there, Councillor Grewin. You see in the report this time round, what we probably need to do now is be a bit more explicit about what that actually looks like and why. So how much time and for what purpose, and it'll be things like team development, but also that social side that you mentioned and the bits that Councillor Scopes talks about being present to show visible leadership and coaching and mentoring support. They're incredibly important in terms of us delivering on that best place to work promise. So it's not all about the nuts and bolts of the job, it's about the team and the leadership that goes with it as well.
Thank you. Neil, do you want to comment as well?
I think so. I think there are people who need to come in because the job needs to be done. I think the other bit where you need to come in is around the development and the team ethos, if you like. So you might well be able to do the mechanics at home, but actually that's what you miss. And I think in reality, that's where we've gone in the last year, actually, is that what we've been doing is bringing people in on agreed dates. So actually they do function as a team. So something like finance, which are part of, you'll have a full office of the relevant people. So when they're in, they can talk and they can do the supervisions and the one-to-ones and so forth, because sort of sitting just randomly in an office, I mean, that works for some people because actually not everybody's got a convenient place to work and so forth. You need to make that space available, but the key benefit is the social benefit in many instances, and I think that's really what the pattern is going to be in future, people coming in together and using that time to kind of build those relationships.
Councillor Cooper.
Yeah, just quickly, Chair. Just to add to what's being said, I think actually the paper talks about a hybrid way of working, and it's not necessarily as detailed in terms of a day, 2, 3, 4, whichever in whichever place, but really looking to get to the best point really within that way of hybrid working. So to get all of the things that you've talked about, Councillor Grewin, in terms of the efficiency you felt you had at home, as well as actually to be able to still do that development, training, coaching, you know, all of those types of things, but also that that buzz that you talked about within the office as well. So when people are maybe in the office, and I know Councillor Flynn didn't like the term team zones, but that's why it's in the paper, because it talks about actually being your whole team being in at that time, so that you get that kind, and you can have those aside conversations that you wouldn't normally maybe have on Teams. You're able to still do that as well. So so for me, it's trying to get the best of both worlds amalgamated into one that actually works for the people who are carrying out that work, but also works better for the people of Leeds who we all quite rightly serve. Thank you.
Thank you. Angela, do you want to comment as well?
Thank you. I was just going to add to that, I mean, one of the big reasons why we want to target a minimum occupation of buildings being about 80% is not just so we're making the best use of our spaces, but also that when people are coming in, they're coming in and not sat on empty floors, so that they are sat alongside people who they can have the chance encounters with, they can overhear, they can work together. And also a big reason why we're opening up spaces right across our estate. So it isn't just doing that in their team zone, it's actually doing it right across the city on wherever is most flexible and most appropriate to do that.
Thank you. Do you have a supplementary, Councillor Gwynn? No, thank you. Okay, Councillor Firth.
Thank you, Chair. And it's certainly been interesting to hear the debate so far. The reason I do have a concern here that's raised otherwise, which is to do with the development of our future workforce. The principles of hybrid working expressed in the report is that the majority of people spend most of their time working from home, and that the council will continue to support hybrid working because it is effective and will not compromise service delivery. And those are direct quotes from the report. But as Councillor Flynn has analysed, it's very difficult to analyse whether actually that is delivering. And my concern is that the only analysis it seems to be that's actually contributed to this report is coming from our senior leaders, who are then judging how well we're actually delivering it. But actually, at the same time, is there not also two factors to take into consideration? There is, with any of us, whenever we're self-analysing ourselves, there is potential risk of being biased about that, and also that you don't want to expose any potential risks because you may believe that you're making good progress. And that's not to say that they're actually there. It's just the fact of it's human nature. So I wanted to ask, what are we looking at, first of all, about analysing our younger workforce or our onboarders to actually see whether they feel they're receiving the correct development and correct support? Because actually those chance encounters, it's actually the chance moment in which you think about something, whether you actually feel that you can ask somebody who's sat next to you, or whether you've actually got to ring them through Teams to actually ask the question, and that awkward situation. And then the second thing is, have we ever, or are we exploring independent evaluation to make sure that we are making sure that our productivity is still retained at a level that is what is acceptable? Thank you.
Yeah, a couple of points, and I think I'll take the first bit and then Angela maybe the second, linking to some of the university research that we've been involved in, and particular, Councillor Firth, in terms of the new starters and the importance of making sure they feel well connected and get the right support early on. We're doing quite a bit there, and as part of the university research that has recently taken place citywide, there's a 10-point plan that's come out of that about how to provide effective support for new starters in a hybrid world. So we'll be adopting that as a council and taking that forward. And it's all the things we've talked about, being present in the workplace, providing a mentor and coach for people, making sure that the personal development is readily accessible, whether you're at home or in the office. So there's a lot of a good framework there that's developed independently through that research that we'll adopt. And we're also doing things like we're setting up a new starters community group. So with a bit more of an informal approach, where cohorts of new starters we bring together, and we, the express purpose being to say, how are you feeling? Checking in with people in terms of their initial induction. We're repeating that over time. So if you can imagine, the first week and then first month, first year. So we're trying to make sure that in those early stages of people's career, they've got the support that they need. So there's a lot going on there, and we're trying to learn from all the research that's out there about how best to support our new starters. And that's all part of a wider corporate induction review that we're actively doing at the moment. And then in terms of how do we check against, independently, and whether we do that, Angela?
Thanks, Graham. We've been working with the University of Leeds over the last 18 months, who have a UKRI nationally funded research paper on the future of work. So we're part of a multidisciplinary and multi-sector and industry group, so that's private and public sector, who are all sharing their experiences, their data on what does life after or during a pandemic look like as people are returning into work. It covers a multitude of things about how do we basically just adapt our offices to make sure that we're ensuring good productivity, through to network studies. So how do people build a network if it's more virtual rather than the chance encounters, and also early in careers, how do people make their learning adapted to hybrid and also build their own network as that's coming through. That study is coming towards the end of its first research paper, and if members are interested, that can be circulated after this meeting. And additionally, there will be a further output from that study in September. I think comparatively speaking, we are doing well. That's not to say that we don't have much further to go, given that we're only on the start of this journey. In terms of our occupancy, in terms of benchmarking with the private sector, the public sector as a whole is probably better utilised and more people are coming back into places, probably for a variety of reasons. And the output from the network study is really interesting in terms of services have already started to adapt how they're training, not necessarily our young, but people who are early in career or early in grade, which is about mentoring, as Graham said, actually shadowing. So that I know for my leadership team, for instance, we make sure that we're available every day of the week so that we're there to make sure that we don't have those catastrophic thoughts where someone, instead of just asking a quick question, gets to stew on it or then books time in a meeting. So that presenteeism is still very valid in terms of people's development.
Thank you. Do you have a supplementary?
Thank you, Chair. No, I appreciate those answers. I think the biggest situation here is the fact that we need to reflect on how everybody in the workforce feels, because generally in organisations, the fact is the more experienced you are, the more likely pre-pandemic you were to be granted hybrid working or being able to work from home. And as a result, we actually need to speak to those who potentially weren't able to take advantage of that pre-pandemic, rather than those that actually potentially have actually been able to use that in the past. And that is the real concern, is the fact that actually it was available to people before and therefore they'd adapted to it, whereas actually those people otherwise will not have the same opportunities going forward. I did want to ask a slightly different question, which is in relation to the disposal of buildings, which is the fact that obviously we are decreasing our estate to not only make sure that we can make savings, but also that we can improve our ability as a council to be, our energy usage, our energy sustainability. Are we not just passing on to the private sector or whoever purchases those buildings the inefficiencies in terms of energy consumption, that those buildings are the reason why we've got rid of them in the first place? Thank you, Chair.
Thanks, Councillor. Can I just come back on the first one, dear, that importance of listening to people? Whilst this latest survey is focused primarily on the senior leaders, do remember through all our past work, we actively listened to 8,000 people who are in the office worker category, and the best place to work pledge, that is specifically reaching out to the 7,000 frontline workers in terms of what they need. And the new market approach, which some of you might have visited, is a good example of where really important and impressive changes being made, for some of those frontline workers too. So we do that. We will continue to do that. It's just this recent take around how effective is it as being predominantly the senior leaders in the organisation.
And just to come back on your buildings point, when we offer our surplus assets to the market, the majority of the time they are brought back into a different use, as certainly developers or new occupiers look to modernise and target a different market to us. So I don't think it's as straightforward as just passing on inefficiencies. It's passing on an opportunity for redevelopment and investment in a way that we don't have a need to do.
Thank you very much. Okay, I'm going to bring in Councillor Ritchie next.
Thank you. I know in terms of changing the workplace, there's been a lot of work with the workplace and staff networks. I know I've worked with a little bit with Terry, who briefs me on accessibility to offices, and closing some of that old estate down is crucial to that. And new market approach is mentioned. I understand that's a bit of an exemplar setup, so well done for that. So my question is, I'm happy, I'm pretty assured that workplace assessments, workstation assessments will be done at work, in the workplace effectively. But what about at home? How quick are we at reacting to staff requests for those workplace assessments? So it's a health and safety question, really, which is referred to in the report.
Graham.
Yeah, and again, a really important question. I think Councillor Ritchie, the inquiry that we've done over the last couple of years has really put wellbeing and inclusion at the heart of all of this work. So, when the pandemic first hit, there was a dedicated helpline, where we made sure that people who were transitioning from work to home overnight got the support they needed, particularly with people, affected around disabilities. We made it the provision for 800 people to work at home. So, one of the important principles still in the report is nobody will be forced to work from home. So if you need to be in, whether it's for your well-being or inclusion or disability reason, you can be, and that will never change. And that's important. And then in terms of the wellbeing survey work we do, which is fed a lot of the disability action planning work that Terry Pycroft and the team have picked up. There's regular checkpoints with staff to give them an opportunity to say two things really: I'm struggling, I need some support, or I need some extra contact. So that's there, regular, built into our wellbeing surveys that we do. And of course, on top of all of that, and probably the most important, is the day-to-day contact with line managers and making sure they ask that question around how people are doing, how they're feeling, and what support they get. And a good example just at the moment is we're going through the round of appraisal conversations again, and the well-being, the accessibility, that question around how things are working for you is at the forefront of that question.
Want to go back, Councillor Ritchie?
Yeah, so thanks for that. I was actually asking a more specific question, perhaps it wasn't clear. So if you're working from home and you get a bit of tennis elbow from perhaps using the mouse or not having the appropriate chair, how quickly will we resolve that? Go and do a home assessment and whatever, and make sure they've got everything in place? Because I'm aware of a family member who works in the private sector who's been waiting a long time for that, and it's not very good for their health. So I want to know how good we are at it.
Yeah, so sorry if I wasn't clear on that. So in terms of that initial move from people working to home, we probably did 1,000+ assessments of people's needs at home, and that was to supply kit to assess their home working environment. So I'm pretty confident that at that time most people got what they needed, and through those other routes I've described, there are always opportunities for people to say, look, it's not working for me now, my needs have changed, I need to revisit that. And through things like our occupational health team, the health and safety teams, the HR teams, through the line management route, that opportunity to flag those things is there, and our response times really good on those. And in addition, we're going to add in the idea of a regular, maybe annual DSE assessment at home, so that systematically picks up people's needs on a regular basis.
Thank you. Councillor Burke.
Thank you, Chair. It's a very short question and perhaps a couple of comments. One, can we have access to the EIA report when it's complete? Because I think that will help us look at things in the round, because it will presumably overlap lots of areas. Bit of an abstract question, I guess. People in receipt of access to work who desperately want to work here full time because of the impact that not using that money will have. I know you've already said nobody will be forced to work at home. Do we have any incidences like that? And my last bit is a comment, really. Well, it's a bit of both, I guess. Have we looked at other authorities and how they work? Because I think we're talking about home working as a result of the pandemic, but I know for a fact there were people in other authorities, I must add, who did it consistently before. I'm using my niece as for example. She works for another large authority, Nelly said then. And she's worked from home for 6 years. She's also in a managerial role, and she goes in once a month and absolutely loves it because it allowed her to manage her home care. So I think there's a danger that we're making huge assumptions as a result of the pandemic, when actually I think the pandemic has probably offered some opportunities to people. So rather than being a barrier, it's maybe enabled people to work in a way that maybe wasn't thought of before. Because I think particular local authorities and civil service and other like God, we're sometimes very, very stuck in our ways. So maybe this is an opportunity rather than a barrier for people to change and work in a different way that actually suits our people rather than forced upon them. That's all. Thank you.
Thank you. Graham?
Yeah, so quickly in response to that, in terms of the equality impact assessment, yes, you can see that. And I think it'll be one of those pieces of work that constantly develops. So I think it'll never be finished as we implement. So of course you can see that. And I think it'd be helpful for this group to see that. Access to work, yes, we do that. We are linked in, and where people need that support through those conversations, particularly the health and safety colleagues, that does get accessed. So yes, that is in place. And in terms of the opportunity rather than barrier, I think you're right. And I think the feedback is that a lot of our people, particularly with disabilities, it's given some new opportunities for them to work more freely, more effectively at home in different locations. So I think that's definitely the case.
Yep.
And just a last comment, it's really good to see that the trade unions are fully involved and have got a working group, because I think we can all be reassured that everything will be done with workers' rights at the forefront. Thank you.
Okay, thank you very much, everyone. Really appreciate it. Neil, do you want to comment before?
Yeah, just one last thing to say, really. I think this issue about judging what is the right mix is going to be an ongoing assessment. I mean, in speaking actually to quite a number of like big organizations with call centers in the city, it's interesting that actually they come to different conclusions. Actually, so there is no sort of hard and fast kind of answer. So a couple interesting, not hardly anybody was getting everybody back into work. A couple were going a couple of days a week. Some were entirely laissez-faire. Others, once every few weeks, more supervisors in than frontline, all sorts of different kind of patterns. And I guess over the next 12 months, we'll start to see a bit more of a consensus starting to emerge about what is working commercially in some of those organizations. But at the moment, it's so new, and it's so difficult in fact some sense to separate the pandemic effects and so forth on performance too, that I don't think there is a kind of really kind of settled view. So yeah, it's changed for good. I think these are some sort of really sensible principles, but actually there is a need for like ongoing assessment of performance and adjustment, because you're right, in the end what counts is what are we going to be delivering to the public. One of the issues about delivering to the public is ensuring we have staff as well, and a motivated staff. So that's all part of it. That's all part of the equation. We'll come on to that maybe later. Okay.
Okay, thank you very much. It's been a really useful and interesting debate. Noting the time, I'm just going to put in a short comfort break for everyone. So going to pause now, start back on bang on 12:20. So everyone's got 8 minutes. Thank you very much. Hopefully we'll start again in a minute. We're back on live. Just thought I'd say that so everyone's aware of that. Okay, so we're going to move on to item 9, which is workforce recruitment and retention, which is quite interesting because it ties into some of the things we've already been talking about, both in terms of agile working and IDS in terms of having the right software for our people. So hopefully we'll be able to link that into your comments. So welcome, Andy and Claire. Can you introduce yourself before you start? And as always, if you assume that we've read the paper, but if anything in particular you want to draw out, please do so. Thank you very much.
Thank you very much, Chair. Good afternoon, everybody. I'm Andy Dobman. I'm the Chief Officer for HR. It's nice to be here. To my left is Claire Matson, who's the head of HR, who has particular responsibility for recruitment and resourcing. Just a few really quick introductory comments from me on this paper, item 9. So as you know, workforce recruitment and capacity is a key part of our 5-year people strategy. But particularly over the last year or so, this is an issue that's become more significant for us as an organisation, not least because of the challenging labour market issues, some of the demographic changes and issues that we put in the paper, but equally some of the downward pressure on costs of living. So what this paper sets out really is our response to some of those issues, and perhaps there's 2 key elements to share with you. So as you'd expect, there's a huge amount of workforce recruitment and capacity management across the council, led very much by individual services, by the managers in those services. So, for example, earlier you've heard from the Chief Digital and Information Officer about some of their activity they're specifically doing to deal with their recruitment issues locally. But in addition to that, obviously there's a whole range of council-wide interventions that we can and we are now taking. And this is very much, if you like, focused very much on augmenting our infrastructure, our systems, our processes, so we're in a better position to build workforce recruitment and capacity. So the paper that you've got very much focuses on the latter of those, so at that council level, corporate wide activity. And what you will have noticed as a scrutiny board is our point really that when thinking about workforce recruitment and capacity, there's a whole range of multifaceted activities and interventions that we can and need to take on this. So it's not just one thing we need to do. There's a whole range, and you can see the infographic we provided in the second page of the paper, which teases out some of the whole range of different interventions. So it's not just looking at things like recruitment and selection, but also focusing on workforce planning, some of the retention issues, onboarding, induction, skilling up our workforce, progression and training. And it's really very much making the point that we need intervention in a whole range of those different activities. This particular update paper, I guess, focuses on a number of different things that we have focused our attention on over the last 6 months or so. So there's a section there on broadening our entry routes into the organisation, a paper there or information on recruitment and selection activity, and finally some of the longer term work on workforce planning. I'll probably leave it at that for the time being, Chair, but obviously very happy to take any questions. Thank you.
Yeah, thank you very much. Also, I forgot to mention that we started. Councillor Flynn has given his apologies for leaving the meeting at this point. Okay, I'm open to questions, but as no one's indicating, I'll start with mine. So I think one of the things I think is quite interesting is the different areas of where we have vacancies, and I guess we've already talked about IDS having a lot of vacancies that are quite bespoke in terms of the skill set required. Do you think there's other areas as an acute issue with recruiting? And is there any other strategies we can do specifically for those really niche? It's not quite the word because everyone uses our IT systems, but very specific skills. And then the second question I have is, I think it's quite apparent from your report, and I think everyone's gut feeling that the pay level is really important to any recruitment and retention thing. We all want to believe there's more to it, but often there's a hard facts of the mortgage to pay or rent and bills. And I guess any comments around the council's pay structure versus, I guess, other organisations, and any thoughts about that? And thank you.
Thank you, Chair. Okay, so just the first issue in terms of the hard to recruit posts. Yes, I think it is right to say that there is a big variation across the council in terms of the broad range of staff occupational groups that we are recruiting to. And there are certain services, certain areas where it is harder to recruit. So you rightly mentioned some of the very specific technical roles, particularly in IDS, that are very competitive in the city, the region and nationally. There's also other areas that we've touched on as well that generally are harder to recruit, not so much because they are specialist or technical, but because they're high volume areas. So we need fairly large volume of staff coming into the organisation. I think our general approach to that is that we need something bespoke to those individual areas. So there's not always going to be a one solution that will enable us to remedy those hard to recruit. So, for example, the remedy in terms of supporting Leonardo and the technical gaps will be different from those areas, say, in adults and health. So our task at the moment is to make sure that we are flexible and fluid enough to be able to respond to those different areas. And we teased out in the paper some of the specifics in that. You are right that obviously base pay particularly is always going to be a key issue. And really what we are trying to do at the moment is think very much about that broader employment offer. So obviously pay is there. As we put in the paper, we're obviously part of that national collective bargaining framework, and that is going through its process now at the moment. So we're not quite sure where that will end up, but we will know over the next few months, and that will really help us to determine where we are in terms of the pay agenda. But whilst that is happening, I think there's also that range of other interventions that we want to tease out as well. So we have put reference there to that broader total reward package. So not just thinking about base pay, but other benefits that we want to focus on, but also thinking very much about supporting staff into the organisation about their career framework and their progression, the skills and the development that we can offer them. But also thinking very much about the values base of the organisation and focusing very much on recruiting people into the organisation because of the public good argument, because they can really contribute to their communities and society. So it's pay is there, you're absolutely right, is a key focus and factor for us within that national environment, but recognising there's a whole range of other local features that are important for us to focus on.
Okay, thank you very much. And Neil, do you want to comment as well?
Yeah, I mean, just on the pay issue, I suppose where we councils in general are different from many private employers is that we do so many functions that the equal pay challenges are much more tricky for an organisation like this, as opposed to, let's say, a building company will pay what they need to pay, but we will need to compare what our building staff are getting compared to our social work staff, for example. One will be predominantly male, one will be predominantly female, and so I think our pay structure has got to be based around equal pay judgments. And I think whilst these things can be revisited, revisiting that is a huge task with all sorts of kind of legal implications and massive financial implications if you get it wrong. So I think what we will be, looking at instead predominantly is issues of market supplements. So people will get their grade, but you justify it on a really strong assessment of what the market is paying, and that is reviewable in relation to the market. So let's say you take something like construction, we are struggling with things like surveyors at the moment. So there may well be a strong argument for a market supplement, but let's say in 2 years' time, the building industry collapses and there is a surfeit of surveyors, then that market supplement would go. So but I think you'll see that more in evidence. We're using it already in digital, but you'll see it more in evidence in other bits of the organisation where we are facing quite significant gaps between what the market is paying and what our grade is based on equal pay.
Thank you very much. Okay, I'm going to bring in Councillor Burke.
Thank you, Chair. Just a couple of questions, really. Your apprenticeship offer. I know that you have the entry level, which is the traditional place, but there's also the graduate entry level as well. It strikes me that there's a step in between those two where you could perhaps have for an FE level. So people who wish to train perhaps as surveyors, it's a 4-year program, isn't it? And perhaps there's an opportunity there because there is a whole host of people who don't fit into those two. And it would further use the levy, wouldn't it, instead of sending any back, just a suggestion. Around the panels, I notice you're having one of the workers groups on it. Perhaps there's an opportunity there for an external, and by an external, I mean maybe an elected member or a like person from another organisation, maybe, to act as some kind of scrutiny on those recruitment panels. Just a suggestion. And the turnover of staff in terms of percentages, I can't find that anywhere within this report. So I think that would be, and of course that would be dependent on grade, wouldn't it? And working hours, and there's lots of subsidiary things that would influence that. I think the main one is the apprenticeships, and how we could perhaps encourage more people to come forward to fill those roles by training them internally, which of course is what happened years and years ago, isn't it? It's not new. Thank you.
Thank you, Councillor Burke. Okay, so in terms of the apprenticeships, yes, you're absolutely right. So I think one of the key focuses that we've been looking at over the last few months is those different entry routes, and you rightly mentioned some of them. I think the approach generally is make sure that we keep a very broad, open range of different routes in, rather than focusing on just one, because we don't think that's worked for us. So let's keep it broad. Just in terms of those different routes, I think you're right about reference to FE. I think probably on most of our focus on FE at the moment is probably through the T-level route, because that is predominantly through the FE colleges. I guess at the moment that's focused on just 2 disciplines, 2 different areas, and it'd be nice to see those broaden beyond the health and those other areas. But you are right that I think is a growing area, and that's certainly something that we can focus on. Your second point is just about the objectivity of panels, and I think that is a key issue in terms of selection. And I think we're always looking at ways to make sure that that is broad, again, diverse and open and objective. And if that could include those external, not just to the particular service that is recruiting, but equally external to the organisation, then certainly some of our roles, we do bring technical assessors or external people on board, depending on the nature of the job. But that's certainly something for us to reflect on. So thank you for that comment. Turnover, you're absolutely right. Turnover across the organisation is really variable depending on the different service and the different staff groups. Collectively, as an organisation, our turnover figure is around sort of 10, 11%, which is pretty low actually compared to most of the other big employers in the city or comparable organisation. So that's a positive, but obviously our focus is on looking at those areas where it's higher, and if it's a problem because it's higher, then what the solution, what the remedy might be.
Thank you. And just one last suggestion maybe, and it's based on some work we did years and years ago. There's quite rightly a focus on the actual recruitment process and how that works, but I think there's a step perhaps before that which is incorporated into the recruitment process. And by that I mean some people are put off applying because they'll read an advertisement and think, I can't do that, that's not for me. So the work we did, and I'm going back several years, we looked at job vacancies and mapped the core competencies that we required for that vacancy onto the curricula. So by doing that, we knew that somebody needed to be level 1 literacy, perhaps entry level 3 numeracy, whatever it was. and you could recruit accordingly. So there's not an expectation that someone's recruited and then they will stagnate forever. It's making those advertisements actually fit what you actually need. And I think sometimes there's a danger of writing an advertisement that meets equalities law, but perhaps is a bit far reaching for some of the roles. Thank you.
Thank you, Councillor Burke. Yeah, in terms of the adverts, that is one of the key areas that we're looking at actually, just to make them more inclusive as well. So the adverts to be more inclusive and in a way that people will be able to read them. I think that's something that I can do really to try and attract a more diverse talent pool, really. I think in terms of the skills and competencies, that is something that we do have on the agenda to kind of look at in a bit more detail. And I think at the moment we're focusing kind of on the recruitment side of it, but recognise that that is something that we need to look at in terms of that career progression as well for individuals, not only coming into the organisation, but once they're here and existing members of staff to be able to kind of see that pathway through. And I suppose that links really strongly with the workforce planning route that we've got as part of one of these strands of work to make sure that we're picking up on that. Thank you.
I just have one last one, sorry. And with that in mind, perhaps there's a place to, if somebody is not at the required, say they need to be level 1 literacy, they're not there, if they undertake with a third sector or a training provider using devolved budgets, as long as they do the work, perhaps a guaranteed interview when they attain, and that way you'd kind of guarantee a stream of people.
Thank you. Yeah, that's one of the things that we've been doing quite well with the We Care Academy within Adults and Health, in terms of people that are coming forward who maybe aren't suitable for the role at that point, but actually signposting them through to different organisations that can help them get to the point that they need to be. And as part of the wider recruitment strand as well, we're actually thinking about people who've applied for posts, but they've maybe not been successful in turn, for the post that they've applied for, but actually what can we do to keep them warm and look at opportunities for them to kind of look at other posts within the council that they might be suitable for at that point, but actually how can we then develop them to where they need to be? Thanks.
Thank you very much, Councillor. Those are helpful suggestions. Okay, Councillor Carlisle.
Thanks, Chair. I appreciate time, so you can take these as comments if you want, rather than requiring an answer. But there's a couple of points I want to bring up, because one of the things, obviously, that we're most proud of in Leeds is that we continue to pay all staff at a minimum the real living wage. Obviously, our aim in doing so is that encourages all the other employers across the city to do the same. So in a way, we're gradually working ourselves out of having a benefit in that area, but that's obviously the right thing to do. The other thing, actually, that wasn't as brought out in the report as I thought, but you did mention in your introduction, was the value of a job at the City Council. Because I went to a few years ago, I went to a recruitment event at University of Leeds for some of their graduates, and it was a government recruitment event. To be honest, most of the people there, I think, wanted a job in GCHQ or the Foreign Office or one of those big ticket items. And none of them, I think, wanted my job after we explained the allowance and the hours that we maybe get, but the reward is obviously different from that. What I do remember was there was a member of staff, I think she was from the HR team actually, who really well portrayed how, through the functions of her role, she saw the benefit that having a job at Leeds City Council benefited her community and the city as a whole through the values we have as an organisation. I think that wasn't in the report, but you did mention it, and I think that's one of our real benefits here, that you can work in any of the services across the City Council, but feel that you are part of the whole, making a difference to the city in which you live and to the communities that you may live in. I guess another aside on that is that with the City Council, you could have a job for life, but not necessarily one career path. You could move across a multitude of services and end up being here for 30 years across all kinds of different roles. So you could start at one thing, end up doing something completely different. And I think they're benefits that I'd really want drawn out of any recruitment plans that are trying to show people the incentives at working at Leeds.
Yeah, thank you. I'll take those as comments, if that's okay. I think that the point you make about team leads is really strong one. Good. Okay, Councillor Firth.
Thank you very much indeed. I thought there were really interesting comments then from Councillor Carlo, but I think the biggest problem is unfortunately that the market that we're in at the moment, that actually that's actually making that impact not as strong, because unfortunately people are having to choose, as I'm sure all colleagues will agree, whether actually they need to go and work for a more competitive salary or remuneration. And I wanted to ask really in terms of an earlier question that I asked. We're recruiting supposedly 110 new staff to deal with the situation around the digital program that we're looking at. We've got as it mentioned in the report, 20% decline in terms of frontline services leaving the organisation. What sort of benchmarking exercise have we undertaken, or do we plan to undertake, to make sure that an independent or outside review or evaluation is to know that our benefits are as competitive as they can be, but also certainly beneficial to the taxpayer? Thank you. Bye-bye. Bye-bye.
Andy?
Thank you, Councillor. So benchmarking is important, and so the piece of work that Claire and her team have been doing is getting better at that data collection and benchmarking our offer to others. So there's a number of key sources there. So the obvious source is locally working with our anchor institutions. So we share a lot of information between ourselves in terms of what the pay, the benefits, the offer is. We do something similar with the core city, so a broader geographical spread, because obviously we are recruiting in the national market for some roles, not just locally. We do a bit of work also with some of the local commercial large employers, so we have a greater sense of understanding as to how they pitch their offer. But also I think what we're trying to do is understand better what our own staff feel, particularly when they exit the organisation, and understand why they've exited. So we now pick up on that data collection as well, which is something that we've only more recently focused on. So we are building that sort of richer data set, so we have that sense of sort of greater benchmarking. The challenge obviously is then what do we do with it, and probably it's back to what I said earlier in terms of understanding where some of the key challenges are, because it does vary from service to service, particular occupation to occupational area as well. So benchmarking, yes, we've got much better and stronger at, but probably more work to do on that as well.
Well, thank you for that answer. I think the reason, I mentioned that, and is I used to work for a firm that did significant benchmarking across the public sector as well. And I think the view that I think that we've got to take is obviously we want to make sure that we are being as competitive as possible, and that certainly that we can then really look at the benefits that potentially we may not be aware of ourselves, that potentially other organisations aren't able to offer, as outlined potentially by Councillor Carlo and others. Can I ask really then the role of the exit interview? I keep raising this every single HR or otherwise updates. What sort of role does it still play? And is it something that we are trying to push out as far as possible to make sure, particularly in such a fluid and candidate-driven market, that we are making sure that there are not particular organisational issues, and that actually it is potentially the market and how competitive we are within it? Thank you.
Thank you. Just in terms of the exit interviews, we've been doing quite a bit of work on that over the last kind of 12 months or so. Obviously, the exit interviews are currently carried out within services with managers and individuals who are exiting the organisation, but we've also developed a survey for leavers to be able to complete at their leisure, without obviously having any kind of discussions with their manager, so they can be really open and honest in terms of what the issues are, maybe why they potentially left the organisation. That's reviewed on a weekly basis to make sure that we're identifying any kind of key changes or trends, and they're picked up with local services, and that's now being published and regularly shared with managers on a quarterly basis to kind of make sure that we're monitoring trends, and correlating that with the conversations that are happening locally with managers as well, to get that rounded picture.
Okay, thank you very much, Claire. Okay, I'm going to bring in Councillor Almas next. Oh, did you as well, Andy?
Thank you, Chair.
Yeah.
Just very quick issue about the benchmarking. I guess one of the other things that we're focused on is when benchmarking, it's not just so we can compete with others. I think what we've also tried to do over the last year is work in partnership with other big employers as well. So we certainly found with our health and social care partners, but a few others as well, is working in collaboration with them when recruiting. So we're doing it collectively rather than independently, because then what we're finding is we are just shifting people from one organisation to the next and breaking that sort of broader health and social care system. So if we can work in collaboration with our partners, and Claire really mentioned about the We Care Academy and other joint recruitment campaigns that we've done. So that's really helped us to actually have a greater citywide impact on the labour market.
Thank you. I'm going to bring Councillor Almas now. Thank you.
Thank you. Really welcome to see some of the initiatives around diversity and inclusion in terms of, focus on changes around the application stages, including, inclusive wording for adverts and anonymous shortlisting, small diverse selection panels, and so on and so forth. What I would really like to see, because this is year in, year out, something that comes on almost every board, but what I would like to see have some targeted approach, and in terms of facts and figures as well, if that could be shared as well, whether it be in percentages or whether it be in actual numbers, because without having that information, I think to monitor, measure success of this positive recruitment or such initiatives, I think it's an exercise that comes back year in, year out. So I think we need to have see more in terms of figures, and not just that. What we really need is some sort of a process where there's mentoring and support also given to the diverse communities, and in terms of the inclusion and so on. Because without that, I think this exercise is great, but without the actual participation of the groups that are underrepresented, it just becomes like an exercise. So yeah, let's have that more meaningful. And I really appreciate and welcome some of the initiatives that you are actually taking in terms of some of the positive steps of keeping them like anonymous shortlisting and all that. So it's really good to see that. But I would like to see a bit more, if you like, meat on the bone in terms of actual numbers and in terms of measuring success, and then reporting back as well. Thank you.
Thank you for that. Yes, there's an awful lot of work happening. We've actually got a new intern within the team at the moment, and he's dedicated full time to looking at the quality, diversity and inclusion, particularly around recruitment. So he's here with us until September and doing a lot of benchmarking and looking at what other organisations are doing. It's definitely at the forefront of all of the work that we're looking at. We are a little bit disappointed that in terms of the recruitment system, that we aren't getting as many responses from people when they're applying in terms of their quality, diversity information. So we are looking to see how we can change where that's set in the process to try and encourage more people to provide that information for us, so we can give a richer report back in terms of how people are progressing through the system and being appointed into posts. It's really important to us, and I would say that in terms of the linking it with the BAME action plan that we've got within the council, and working with colleagues from the staff network, making sure we're linked in with the trade unions, and just working with our communities team, Safer Communities team, to link in with some of the organisations that they work with to try and get the message out for us as an employer, and see we can kind of direct our resources to those hard to recruit groups.
Really good work it has gone on within the West Yorkshire Police and also Fire Authority, and I've been involved with them for the past decade or so. I think it would be really good to have some sort of collaborative approach or some sort of information sharing in terms of what good practices that they have already put into processes and whatever. Because to be honest, it is really difficult to get people, for example, into uniform jobs and stuff like that. But if we can learn some good points from them, then I'm sure it'll make the job a lot more easier. And that's the reason why we need a really targeted approach as well. Like I'm sure, in terms of, declaring your ethnicity and stuff like that. In most of the cases, it's like an optional information. Whereas if we have a more targeted approach, then I'm sure we'll have more positive, if you like, impact and feedback as well. Thank you.
Thank you. Do you want to comment again, Andy or Claire? I would just comment that our staff networks are going to come back here hopefully in December. Last year's work programme, we had 3 or 4 of our staff networks come and present to us and the challenges they thought we had and how we can tackle it. And that's something that's really important to the board last year, and I'm sure will be an important work item again this year. So thank you for raising that, Councillor Almas. It is a really important issue. Okay, I can't see anyone else indicating. Councillor Cooper, do you want to comment?
Yeah, just to say thanks, Scrutiny, for all their comments and questions and challenges and support for all 3 reports. I've got to say that you've just been through in much detail. Of course, all 3 of them are so interlinked. They are dependent on the other 2 being successful. As well, so it's really important that we get the digital strategy and the digital offer right, so that we can allow that agile working, and then the agile working then may encourage more people to come forward for more posts in the council as well. That's just one of the things where they're linked, but there are many other layers within those reports that link as well. So I just wanted to make that point. You can't just have one without the other in this. They really are dependent on each other.
Yeah, thank you, Councillor Cooper. It's one of the reasons why we had them all together, which is it's impossible to separate them all. So thanks for that. Councillor Burke, is that hand up? You want to comment as well?
It's just a comment. Thanks for that, Councillor Cooper. Just one last comment. We were involved in some meetings with a couple of government departments, GCHQ being one of them, about how they could attract more people from a diverse background. This is about 3 months ago. One of the things they did, and perhaps it's just a suggestion, were to get people from a diverse range of backgrounds and said, what affects your community? What are your ideas? What are your plans? There's some positives to that. I think there's also some dangers, and that's about the people you actually select. So it's just a suggestion, really. Thank you.
Okay, thank you. Councillor Firth, do you have a comment as well?
Thank you, Chair. I just wanted to add one thing, which is also to add in that I think it's absolutely right to be having the discussion that we're having to make ourselves more inclusive as a workforce. And also one thing that we have raised, as well as representing the city, but has also been representing people's abilities across the city. And unfortunately, we have a large disabled population who are people who have certain capacity issues. And therefore, as a result, I just wanted to ask if certainly in the future we can provide more detail about how we're trying to attract more people from who are less able to maybe fill out an application form online or otherwise may be able to take part in, delivering for our city. I just wondered if there's any more meat on the bone they can give there.
Yeah, thank you. It's really important area for us as well. It's just actually last week we were having conversations with the Being Employed Leeds group, who are actually working with people with learning difficulties to kind of support them into employment, and looking at opportunities to how we can directly pull through job adverts at entry-level routes and other appropriate roles into their Being Me website, which actually directed to people with learning difficulties for them to be able to identify jobs that might be suitable for them. So that was one strand that we've done. We've done quite a few different areas where we're looking at, support for people at interview. So when they're coming into interview or assessment, to make sure they've got appropriate support there for them to be able to fully engage in the process. So it's definitely something that's on our agenda, and we've already started those conversations, but I'd say we're probably at the early stages of it at the moment.
Okay, thank you very much. Okay, I'm going to close this item and move on to item 10. So thank you very much, Andy and Claire, for your time. Okay, move on to item 10. I think that's Richard. Hi, Richard. Thanks for coming.
Thanks, Chair. This report provides analysis of the level of council tax that's receivable by ward in the previous financial year. So it shows the gross figures and the net payable, and you can see through table 1, you can see it allocated to each of the wards. The second table then does a similar exercise in terms of level of business rates receivable by ward for the previous year, and it shows the gross amount payable and then the net amount after taking account of discounts, reliefs and exemptions. And then the third table shows us a totality of the two previous tables added together. Just to give a bit of context in terms of looking at these tables is to take account as in terms of the government's assessment of a local authority's needs to carry out its statutory responsibilities. It looks at it in totality and then takes it on a citywide basis and doesn't do an analysis by ward. Similarly, in terms of the council itself, it doesn't account for expenditure it incurs on a ward basis, and it also doesn't currently budget for what it spends on a ward basis, and to do so would require a significant piece of work to do that. Of course, business rates and council tax get consolidated along with grants and revenue support grant into the total level of resources that the council receives. We detail that in the council's medium-term financial strategy, which go to September's executive board, and from that we then have the annual revenue budget, which goes in draft to executive board in December and then to full council in February. Thank you, Chair. I haven't got any more to add, but if happy to take any questions there are any.
Thank you very much. Do members have questions? Yeah, Councillor Ritchie first.
Yeah, thanks, Richard, as ever, from yourself and your team, a really comprehensive report. But one question I have put to the chair is why this has really come to scrutiny, because it is stating the obvious, really. You know, it's no surprise that some of the outer areas with the bigger houses generate more council tax, and the inner city area generates the most business rates. Whether it's an exercise of they get more than us, I don't know, for political gain, I have no idea. But you've put in the report, the statutory services are demand-led. You cannot start evening them out if there's a bigger demand in one area for children's services. We have got a transparent policy on some of the other discretionary spends, I suppose, like on highways. So it's laid out on a priority basis across the wards, and members can influence that, and I certainly have done in my ward. And then there are other issues around things like investment in parks, which is through Section 106 and development gain. So again, some areas lose out on that, but we've got the LQP, Leeds Quality Parks Standard. I know the exec member is keen to level up in the city around those sort of things. The other thing to factor is the impact on, say, the inner areas of people accessing the city centre. So it's the inner areas that, you know, face the most pollution and congestion as well. So how do you factor things like that in on the impact of people? So it's a useful report, but I would have thought that could have come to a member on a question rather than it needing a scrutiny inquiry personally. Thank you.
I don't know if you want to respond to that, Richard. It's maybe not the point about why it's here. I guess that's not necessarily your job to answer, but unless you have a comment. But I'll leave it to you if you want to comment.
I think it was coming here. I think, Chair, there was a request from a working group in the previous financial year for this sort of analysis. So we're just really responding to that request. And in terms of just some of the examples you've given, again, in each case, it's a citywide delivery of the service, and so the various examples you've given, you've shown exactly how members, or it can be influenced in terms of where that service delivered. But the point is, from this analysis, is you're getting the low resources do come obviously generated from a ward. The reality is they are determined how it be spent on a citywide basis, and that's how the government also assess, not just for Leeds, but every local authority in the country, and what level of resources is required to deliver those statutory responsibilities. Thank you.
Thank you. Councillor Firth.
Thank you, Chair. I think just to add some clarity, the reason why this matter has gladly come forward is actually for information that Councillor Matthew Robinson wrote to, a former member of the board, wrote to the Chair last October, requesting that scrutiny into the current system to configure council tax data was actually pulled together, and that actually, because we were looking at other matters to do with council tax collection at the time, that therefore that's why it was delayed. And the one thing I wanted to come into particularly was obviously the nature of the report itself says that all residents within Leeds City Council's area should receive the same level and quality of service, regardless of where they live, and that to start to analyse income by wards and compare this to the services provided would create disparity of service provision across the wards and drive the wrong behaviours. Is this a fair claim that whilst accepting that expenditure takes place according to the need on a citywide basis, it may still be useful for residents to see a value for money analysis on a ward by ward basis if it were possible to produce? And would that be something that the department will be able to take forward? Thank you, Chair.
I think it's pretty clear from the report. They're saying they can't do the analysis ward by ward in terms of expenditure. I think it's pretty explicit in that nature. So I think that's a sort of a mute question. So I'm not sure Richard can add anything, but Neil wants to comment, so I'll let him comment.
I think what we try to do is you can always do more to publicise it. We try to do, when we send out the council tax, what we spend our money on, to try to explain where it goes. And I think unfortunately, there is probably a real misconception amongst the public about what we do spend our money on. So, people do think of refuse and highways and stuff, but that's a tiny, tiny percentage of what we actually spend. So now 60% is going on children's and adults social care, really. So which is driven, as you were saying, by the needs of those individuals who need support on adult social care. That's about 40-odd%. So it is kind of a bit meaningless at a kind of ward level to kind of give that. I mean, I think once you've taken into account, servicing something like historic debt is about 14% or something like that. So you're getting to, quite a small proportion of spending, which is about universal services. And I said, we do try and set that out in the council tax. It's something which we could, in the council tax kind of leaflet that goes with it, something which we can revisit to give clarity about, the enormous amount of money which we're spending on just delivering those key statutory services.
Thanks, Neil. And I realise I didn't answer your question, Councillor Ritchie, in terms of why it's here. And Councillor first mentioned Councillor Robinson's letter. That's, I guess, ultimately why it's come to the board. I think we need to be really careful about over-analysing where, like Neil said, where money's from and where we spend it. It's got to be needs driven, and we see that in as a group of councillors. We've talked a lot in council about how we get underspent per person versus London in terms of infrastructure. But actually, the London economy probably contributes more per capita than we do. But we feel like we should get equal services and equal investment because of I guess we're a progressive democratic society, and I think if we try to start taking up that away, that could be a problem. Could land us in hot water that we didn't intend to. Okay, I'm going to bring in Councillor Gruen.
Thank you. You've pretty much said it, actually, Chair. I was just going to say that if we agree with the principle that resources should be needs driven, and therefore we would not necessarily find that the wards that generate the most income through whatever means spend the most income, I don't see the purpose of a value for money analysis on a ward basis. I don't get why we would need that at all. Having said that, it doesn't feel as if the most deprived wards necessarily always get a needs driven response to their needs. I mean, I have to say, the roads in Old Woodley are in much better nick than the roads in Bramley and Stanningley. I'm certain of that. And I've seen some roads being redone in the area where I live that I absolutely wouldn't see as a priority, whilst there are roads in very, very bad condition in my ward. So that's just an observation, but I don't see the purpose of a ward-based analysis of value for money if we're not spending it on a ward basis.
Thank you very much. Okay, I'm going to bring in Councillor Carlyle next.
Thanks, Chair. I guess some of it's similar. I mean, there's certain services that will cost more in certain areas, because if it's a service, for instance, based in the city centre, then it's going to cost more to drive the 7 miles to my ward than it is to do somewhere else, but the service still has to be at the same level for those residents as it is for those that live right next to the depot or the office or wherever that service comes from. I guess as a point of clarity, just in this, we've obviously got the gross council tax there that doesn't differ as much per ward, but we've got the obviously that's based on house prices some years ago, and it's no surprise to any of us, I think, that some house prices in certain areas of the ward, let alone the size of them, will be in areas of the city, sorry, let alone the size of them will be different. But when you look at the net payable, then a lot of that will be made up in grants and relief that we get for the reasons that many people will be exempt or get relief from the council tax in those areas. So in a way, the net payable is in no way a useful figure in that point, is it? Because most of the gap between the gross and the net we'd probably get back in various other grants to support those residents. So for instance, in my ward, there's 2.5 million that's not payable, but I'm assuming we'd get that back. I guess the other element of it, because we've got the council tax and the business rates there, but the final element is the revenue support grant that we get from government, which is directed to specific services where it's needed. And as people have said, those services could be needed anywhere. In a way, I'd more like to see that and how it's decreased over time, which I'm sure has happened over the last 12 years or so. We know that a lot more of our money comes from council tax, therefore it needs distributing a lot more than it probably did before. We used to get revenue support grant that we could use more on a need by need basis. So I think in a way, the information we've got doesn't seem to answer any questions, and it's the gaps in it that the bits I'm most interested about anyway. It's the bit that we haven't got that more interests me.
Thanks for that, Councillor Carlisle. Just to comment, we did get a graph from Victoria, the Chief Finance Officer, last year, which had it sort of demonstrated the falls in funding from central government over the last 12 years. And so I'll ask Becky to dig that out and send it round, because it's actually quite a helpful report. Interestingly, didn't allow for inflation, so it's probably real life is probably more significant than that. Do we want Councillor Firth, do you want to have another comment, and then I think we'll wrap this item up.
Thank you, Chair. I think the biggest thing I would say is this: this board meets regardless of which ward it represents as an individual member, and it is for the whole of the city. And I think that we should not be scared of looking at whether we are delivering value for money for even our most deprived wards in the city. I think that actually the more analysis that you have, if you are confident in your case, the stronger you can actually see that in the figures that meet out. I think I just want to make one final claim, which is which is that this actual original request last October came from the fact that the written response to a council question claimed that the information was not readily available. However, this report itself has shown that the data is readily available on a regular basis. So can I ask, it's not clear when this was first the case, and can we confirm how long that information has been available, and are we continuing to publish it in the future? Thank you.
Can you comment?
Yeah, it takes a huge amount of sort of data manipulation to pull this information together and this analysis. So that time and effort has been put into producing this information, and obviously it's now in front of members because of the sort of length of time and it does take to produce this, and also staff are sort of working on other key areas within sort of council tax, like the £150 refunds, etc. What we didn't ask them to do was to do a similar analysis for what it would look like, how much we've got to collect in the current financial year. So obviously it is possible to do that, but it's not a case of just pushing a button to do that. It does take a bit of time to do that, to produce that information.
Okay, thank you, Richard. Councillor Carlisle, do you have a comment?
Just a brief comment. I mean, I think based on the discussions we've had here, not everyone thinks it's that valuable a figure to get anyway. So I appreciate the work that's gone into it, but I think that's shown maybe, were we focusing on this? I'm sure officers would have had it readily available, because it's a question we'd asked over many years, but I'm not entirely sure what benefit we've got from it, really.
Okay, Richard, Councillor Cooper.
Sorry, Chair, I wasn't intending to come back in at all, but I think that last throw of a question just deserves a response, because you've heard from officers, but I'll also tell you that that information was not readily available as you suggest, that it has been readily available. It's taken a lot of time and effort from Richard and his team to get that information together for a scrutiny board report purposefully. So, you know, please don't try and manipulate the truth here.
Is it a constructive comment, Councillor Firth? Councillor Firth, if it's constructive comment.
Thank you, Chair. That is not the intention at all. The fact is that we were only trying to clarify when these figures were first available, and they very kindly clarified that for us. Thank you, Chair.
Okay. We're going to close that item there. Thank you, Richard, for doing that analysis. I know it was there was a lot of work behind the scenes, so thanks to your team. I found them interesting figures. Okay, I'm going to move on to item 11, the work item. Yeah, you're free to go, offices other than Becky, obviously. The work item, I know we've had one request from Councillor Carlisle, which I'll discuss with Becky later. Is there anything else on the work schedule that anyone wants to raise? Can't see anyone. No. Councillor Carlisle?
I'd just appreciate from comments earlier, my request may be for information that is already served by another board. So it may be that we just need to receive that information so I can know where we're going.
Thank you. Okay, so with that, thank you very much everyone for attending. Thanks again to Jonah for sitting so quietly the whole meeting. And I'll see you all next time after some holidays. Thank you.